So, good morning everyone. I'm very happy to see everyone here. And today we will have a very nice session about Ukrainian fast-track cities during the war. You know that the war that Russia started against Ukraine the 24th of February divided lives of Ukrainians and also HIV response for two sides, before war and after war. And everything that was easy before war started to be almost impossible after the war started. But Ukrainians somehow survived, responded, and even succeed in continuation of services, in provision of care and treatment program, in access to treatment and prevention programs. And I think the biggest part of this success, it was fast-track cities. Because before war, 20% of all HIV-positive people lived in fast-track cities. It's four in Ukraine, it's Odessa, Kyiv, Dnipro and Kryvyi Rih. Unfortunately, it should be 5, but unfortunately the signing of Paris Declaration for Mariupol city was planned for 24th of February, and it didn't happen. But we were very grateful to IPAC, because right now Mariupol is honorable member of Fast Track Cities initiative. Even the city was completely destroyed by Russians and nearly surviving now. So today we have like a very brilliant speakers that represent civil society and local governments of the cities, and they will present us all their successes that these major cities of Ukraine made during the war. But before we start our session, I want to ask for some nice welcoming words. Our main partners in all the initiative, and especially in Fast Track Cities initiative, it's our regional director for Eastern Europe and Central Asia, Eamon Murphy. You are welcome.
Thanks, Valeria. It's early on the last day, so I hope we'll get a few more people to come and listen to the important work of this. Like Valeria, I'd also like to thank IAPAC and the other partners, UN Habitat. Kiev was one of the first cities in Eastern Europe to sign the Paris Declaration, and I think that's an important message because Ukraine has one of the most successful responses to HIV, definitely in the Eastern Europe, Central Asia region, but even globally, and the role of civil society. And so we're going to hear that from our distinguished panel. The three other cities, you know, and then even Mariupol, who was recently made an honorary fast-track city, and that is part of the solidarity that the people of Ukraine have managed to build with the international community. I don't think many actually expected the resilience and the strength of the population at the time of the invasion by Russia. So joining actively, we're here to talk about fast-track cities, of course, right? In the context of an ongoing crisis and abuse of so many different rights, human rights and every other right to sovereignty. So joining actively, participating in fast-track cities initiative has been possible because of the unique partnership that has been built up. And it's a partnership that obviously works in different parts of the world in different ways. Great to see our colleagues from Indonesia come. Apa kabar? So international partners, but most importantly, it's the domestic partners in Ukraine itself that have been working with it, the grassroots community organizations, and it was great to see the recognition of the special award to the community that Valeria received on behalf of the community at this meeting. So, as I said, we admire the resilience, dedication of Ukrainians. We also share in the mourning of the losses suffered by the people because of the invasion. I'm often challenged and challenge people when I hear about the economic impact of the war in Ukraine. It's not the war in Ukraine. It makes it sound like it's Ukraine that's the cause of this, right? It's the invasion and destruction that's been caused globally by Russia with this. Yesterday we saw at the United Nations an overwhelming support to condemn the invasion and subsequent destruction of the country. So we stand with you in solidarity with your daily work, both to preserve and strengthen the AIDS response. I visited Kiev, Bucha, Irpin earlier this year in July, and to see both how the networks, the community here had rebuilt the response to HIV very quickly after the impact of the war was admirable, and stands as an example of the importance of community-led work. And so we're going to hear about that from our colleagues today. We worked with partners in country to establish a small emergency fund to try and fill the gaps between the big programs, and that's critical. And we've heard from Valeria the importance of recognition, not just of the health service, but also of social workers and the community workers who are critical to fast-track cities as they were to the response to HIV. We have recently had support from the German government, which is great, which will allow us to also support some of the additional needs that are coming with winter. So there's going to be a need for further support around special needs that are not being met necessarily. So the 5 fast-track cities did not deviate one step from their obligations and commitment to put an end to the AIDS response, regardless. And that was interesting. In the meetings I had in Kiev with government, with programs, with organizations, everyone was talking about the ongoing work, right, despite the invasion and impact. And that's what we'll hear firsthand about the efforts of Ukrainian cities, particularly in this last 7 months. So I'd like to thank the representatives of Kiev, of Odessa, of Dnipro, of Kryvyi Rih, that one I'm not good at pronouncing, for their commitment to the HIV response, but also with the fast-track cities. So it's going to be really fascinating to hear that. And now there are people online as well, so I'd like to welcome them as well as the people who are here in person. From a UNAIDS point of view, we stand with you for the ongoing work and look forward to hearing from you about ideas for further support that we can all collectively work for. Thanks very much, Valeria. Cheers.
Thank you very much for this nice welcoming words, and we would like to start from our first presenters. It's Odessa Municipal Fast Track Team, keeping focus on HIV response. And we have 2 presenters here. It's Dr. Alexander Babenko, Odessa Municipal AIDS Center Director, and Ms. Sala Hodak, 100% Life Odessa, head of the board. Babenko Alexander is a director of Odessa City AIDS Center since 2020. Since 1997 till 2011, he served as a surgeon military doctor. In 2011, he joined Odessa AIDS Center as epidemiologist. Then he became a head of department for epidemiology. And now, under his supervision, works AIDS Center itself and several trust cabinets in 4 districts of the city. As a former military man, Alexander knows everything, how to protect personnel and clients from all kinds of hazard during the war. And we have Hodak Alla. She head of board of 100% Life Odessa and head of the board of 100% Life organization. She started to work in HIV services almost 20 years ago as a social worker at Daily Children's Center, and grew up till the head of the biggest organization in the region and board member of biggest patient organization all across Europe. Last year, Alla received master's degree in management of organization, and we can say that she possesses 200% of energy to run organization, to coordinate and deliver humanitarian aid, and smile. So the floor is yours. Babenko Alexander.
Thank you. Я буду розмовляти українською мовою, тому що її володію краще, ніж англійською. У нашому місті, наше місто одне з перших на теренах України почуяло на собі навантаження ВІЛ-інфекції. Перший випадок був зареєстрований у 1987 році, ще при Радянському Союзі. На жаль, ми всі знаємо, що інфекційні хвороби та такі хвороби, як наркоманія, алкоголізм, найбільше це соціальні хвороби. І вони, звичайно, вражають населення у період кризових ситуацій. Так і сталося у нашому місті з ВІЛ-інфекцією. До 1996 року в місті і в області реєструвалися поодинокі випадки. Станом на 1 січня 1996 року всього по області було 65 випадків ВІЛ-інфекції. Але потім збудник потрапляє у середу ін'єкційних наркоманів, і вже на 1 січня 1997 року в області було зареєстровано 1300 випадків ВІЛ-інфекції. І далі вона розпочала зріст у геометричній прогресії. У нашому місті, безумовно, і влада міста, влада області, влада країни і міжнародні організації розпочали боротьбу з цією інфекцією. Міські програми в місті з боротьби з ВІЛ-інфекцією працюють з 2005 року. З 2008 року в місті сформована і працює координаційна рада при міському голові з боротьби з ВІЛ-інфекцією, наркоманією, туберкульозом та гепатитами. Головою координаційної ради є заступник міського голови. Ну, я наразі являюсь секретарем цієї ради. Але це були заходи, координаційна рада, вона дорадчий орган, тому її рішення не являються, так скажемо, законом до виконання всіми виконавцями. І тільки після того, як мер нашого міста підписав Паризьку декларацію і приєднав наше місто до фаст-треку, в місті була розроблена програма боротьби з ВІЛ-інфекцією, СНІДом, туберкульозом, гепатитами та наркоманією. Перша програма була розроблена у 18-20 роки. Зараз діє, от на слайді вона відображена, програма 21-23 роки. За рішенням наших депутатів програма в цілому прийнята на 3 роки, але кожного року вона коригується в залежності від тієї ситуації, яка, в принципі, міняється, якісь зміни проходять. Тому загальний перелік заходів є. Але суми уточнюються кожен рік і додаються чи убираються окремі заходи. Завдяки цієї програми, образно кажучи, всі міські сили зібрані в єдиний кулак. Якщо раніше ми відповідали таким ударом, то зараз ми відповідаємо ударом, зібраним в кулак. Всі учасники програми звітують щоквартально з заходів виконання програми, з виконання заходів програми, і наприкінці року звіт з виконання програми приймається як законодавчою, так і виконавчою владами. Тобто заслуховується на виконкомі міської ради та приймається сесією міської ради. На цьому слайді ви бачите фінансування програми в першому півріччі 2021 року та в першому півріччі цього року. Тобто цього року вже в першому півріччі був повний розпал війни. І фінансування програми, незважаючи на війну, з міського бюджету було більше, ніж у минулому півріччі. Насамперед це сталося тому, що стало питання, наше місто з 2019 року закуповує, в програмі є пункт 5.1, забезпечення тестування населення на ВІЛ. Ми з 2019 року закуповуємо мультитести для тестування на ВІЛ. Ці мультитести включають до себе 4 інфекції, безпосередньо ВІЛ, 2 вірусних гепатити Б та С та сифіліс. 19-21 роки показали, що використання саме мультитестів дає перевагу перед тестуванням тільки на ВІЛ, тому що знімається стигма у людей, серед населення існує таке мнення, що ВІЛ – це стигматизована, а гепатити – це не така страшна хвороба. Тому люди більш охоче тестуються і саме мультитестами, а не тільки тестами на ВІЛ. А у військовий час це стало дуже нагально, дуже добре, тому що всі мобілізовані, всі призовники повинні тестуватися як на ВІЛ, так і на гепатити, так і на сифіліс. Якщо б ми брали тести тільки на ВІЛ, цим мобілізованим та майбутнім військовослужбовцям прийшлось би в декілька кабінетів до лікарів звертатися, в декілька лабораторій і так далі, що затягувало б час їх обстеження. У нас навіть була ситуація, коли швидко призвали 300 військовозобов'язаних, розмістили їх в польовому лагері, та вони почали там проходити медичну комісію. Ми надіслали своїх співробітників з цими швидкими тестами, і за 2 дні ми всю цю масу протестували, виявили там гепатити, ВІЛ, сифіліс, і вже тих призовників вже їм дали відсрочку. Ось показники по нашій, крім тестів, я кажу про самі глобальні речі, які здійснюються за рахунок міського бюджету. У нас в програмі є такі 2 пункти: зменшення шкоди для ключових груп – це споживачі ін'єкційних наркотиків. У нас працює з цією категорією осіб 5 громадських організацій. Ці громадські організації склали реєстри своїх клієнтів, споживачів ін'єкційних наркотиків, електронні реєстри і, звісно, за альянсовською методикою закодували їхні персональні дані. І ми за допомогою комунального підприємства «Одеса Фарм» надаємо їм 2 послуги. Перша послуга – це видача наборів, стерильний шприц, стерильна серветка. І друга послуга – це обмін використаних шприців на стерильні. І ось ви бачите, що у минулому році декілька менше було наборів у першому півріччі 22-го в порівнянні з першим півріччям 21-го. Було намного менше наборів видано, але обмін шприців зріс. Якщо сложити в цілому, то 22-й рік перевищує 21-й. Ось ви бачите на цьому слайді такий пристрій для утилізації використаних шприців. Тобто, звичайна ємність від води встроюється в тумбочку і туди кидають ці використані шприці, потім співробітники аптеки виймають, закручують, тобто ніякого ризику травмування немає, і потім утилізують. Всі ці і обміни, видача наборів проходять у 12 аптеках КП комунального підприємства «Одеса Фарм». І це дуже зручно для пацієнтів, і вони в будь-якому районі міста можуть отримати цю послугу. Тут зображена закупівля мультитестів у цьому та минулому роках. Ви бачите, що у цьому році більше коштів витрачено на ці мультитести, тому що якщо в минулому році ми могли собі дозволити моніторити ситуацію з залишками, слідкувати, а скільки залишилось, потрібно ще закупити. Тобто ми робили декілька траншів закупівель, то в цьому році ми цього собі дозволити не могли, тому що, по-перше, інфляція, тести закупаються за кордоном, по-друге, ризики порушення логістики, і по-третє, мобілізація, потрібно обстежувати великі контингенти осіб. Це у цьому слайді ви бачите саме тестування на ВІЛ у наших закладах охорони здоров'я, які підпорядковані міській раді. У 2022 році тестування зменшилося, безумовно зменшилося. Якщо
Щиро
ви...
перепрошую, шановні колеги, не підкажете, чи у вас лунає переклад, чи працює, тому що мені здається, що в Zoom є якісь проблеми. Чи є переклад на англійську мову, не підкажете? Можете запитати колег у залі або тих, хто слухає.
Немає.
Немає, тоді я вас попрошу, давайте тоді перейдемо на послідовний переклад, якщо не працює синхронний. Я тут до вас лишаю вибір за тим, з якого моменту розпочинати. Тут уже до вас краще, але я так розумію, що не чули від початку.
Right now we will start parallel translation for better understanding for everyone. So it will be our speakers talking in Ukrainian language, and English translation will be available in this room.
It's Natalia. I'm suggesting Alexander to continue, and Vlad will be translating. Thank you.
У правій частині слайду ви бачите таку кругову діаграму. До нашого міста прибули і стали на облік 262 пацієнти з ВІЛ-інфекцією. В той же час 360 пацієнтів у нас вибули в інші країни та інші регіони. Те ж саме сталося із загальним населенням міста. Хочу вам сказати, що якщо раніше у нас були пробки на дорогах, і я на своє місце роботи з дому 3 кілометри доїжджав за 35 хвилин, то зараз я доїжджаю за 12 хвилин. Тому що багато мешканців міста виїхало як за межі області, так і за межі країни. Тому, звісно, і загальна кількість тестування зменшилась. Однак у нас в місті...
Я тут вас перерву, бо у нас послідовний переклад, тому я вас прошу робити паузи. І я думав, що вам про це повідомили. Тоді я зараз поки що перекладу те, що ви казали. So the speaker mentioned on the part before that right now they have an additional surplus of 262 people with HIV that came to them after the war began. 360 patients or clients that they had, they went to other countries or other parts of the country due to the war. And the general population status is also changing in the same way. For example, if before the war, it would take me the distance of 3 kilometers that I would have to go to work, and it took me like 35 minutes. Now it takes actually 12, because a lot of people moved out, and so therefore there's a lot less tension, and so there's a lot less people, and just so you know the general content. Будь ласка, продовжуйте.
Якщо ви придивитесь до показників осіб, які були виявлені, поставлені на облік і отримуєте РТ, то ви побачите, що як у 2021, так і у 2022 роках ці показники практично однакові.
So if right now you would have a look at the indicators for people detected and people that are currently on the ART, you will see that the indicators in 2021 and 2022 are almost identical.
Тобто в закладах охорони здоров'я, які підпорядковані Департаменту охорони здоров'я міста, ми вже досягли результатів. 95% з виявлених ставляться під медичний нагляд, з них 95% отримують АРТ, антиретровірусну терапію.
So therefore, in the healthcare facilities that are under subordination of the health department of our municipality, we have already reached the indicator of 95% of people who've been detected are now on ART or antiretroviral therapy, and 95% of those are 95% are detected. Thank you.
Це сталося завдяки тому, що в нашому місті, вперше в країні, були створені і законодавчо закріплені наказом Департаменту охорони здоров'я мультидисциплінарні команди.
This was only possible in our city, in our country, because we have created and legally enforced by the order of the State Department the multidisciplinary teams of doctors and other specialists.
До складу команд входять голова команди, це заступник, як правило, медичний директор закладу охорони здоров'я, члени команди, лікар міського центру СНІДу за територіальним признаком, ну далі я покажу, який це територіальний признак, і соціальний працівник громадської організації.
So the general composition of the team is enforced of the head of the team, which is usually a medical director of any facility, which is they also have an AIDS center representative, and they also a social worker from like any kind of NGO or charity organization, and it's all divided by the territorial or geographical principle that I will show you later on.
Голова команди організує в своєму закладі обстеження на ВІЛ всіх пацієнтів, які відповідають критеріям щодо обстеження на ВІЛ. Наш лікар нашого центру організує постановку, проводить постановку цього пацієнта на облік, його до обстеження та призначає лікування. Соціальний працівник забезпечує, так скажемо, трансфер цього пацієнта від лікувального закладу до нашого кабінету довіри.
And so the roles of those people in the team is the head of the team organizes HIV testing in his or her facility for the patient. Then the doctor from our organization is responsible for accounting and prescription of treatment. And so the social worker is actually responsible for provision of transfer from the patient from the hospital to the Devira room, which is can be translated as the trust rooms or trust cabinets, essentially, that we continue to work in.
Завдяки цьому ми маємо такі невеликі втрати виявлених пацієнтів. Крім того, соціальний працівник в процесі спілкування з пацієнтів починає вже формувати в нього прилежність до лікування.
This is why with a system working, we have only the minors of losses in detection levels. And also the social worker, during their discussions and talks with the patient, they are starting to develop on the early stages the adherence to the treatment.
На цьому слайді ви бачите дислокацію наших кабінетів довіра. Ви бачите, що різним кольором відмічено 4 райони нашого міста. І ви бачите, що в кожному районі мінімум 2 кабінети довіра. За цим принципом децентралізації з самого початку і будувався наш центр.
So on this slide, you can actually see the geographical distribution and location of our Devira rooms or cabinets or trust cabinets, essentially, or rooms. So with different colors, you can see that there are 4 districts in our city, and each district has 2 of our rooms or cabinets or departments, essentially. This has all been done due to the fact that we were trying to develop in line with the state decentralization program or decentralization principle. Thank you.
Поодинокі кабінети, де один червоний трикутник, розміщений в лікувальних закладах Департаменту охорони здоров'я. Це поліклініки та міські лікарні.
If you see a red triangle on the map, which is the that our room is located, it's just a single room that's located in the healthcare facility under the health department of our municipality.
Там, де багато трикутників, це наша основна будівля. Там є, окрім лікарів-інфекціоністів, і вузькі фахівці. Це лікар-акушер-гінеколог, лікар-педіатр, лікар-терапевт та лікар-дерматовенеролог, які, окрім надання спеціалізованої допомоги за фахом, теж призначають і лікують ВІЛ-інфекцію, призначають антиретровірусну терапію.
So in the place on the map where you see a lot of like triangles, this is our main building, this is our headquarters. And the thing is, apart from the room, apart from the detection and everything, it also has a variety of different specialists like obstetrician, gynecologists, infectious disease doctor, dermatologists, and others, which not only do they provide help within their regular responsibilities, but also they are helping the HIV patients in their treatment. And some of them can also, like an infectious disease doctor, can also prescribe ERT.
Ця система децентралізації виправдала себе і при епідемії ковіду. Пацієнтам не потрібно кудись їхати в одну точку в місті, коли не пускали в транспорт та були сурові режимні обмеження. Так і зараз під час війни пацієнту не потрібно далеко відходити від місця свого проживання, де в нього є поряд бомбосховище, він може отримати всі послуги безпосередній близості від своєї місця проживання.
And so the decentralization system, or the general decentralization approach, has actually proven itself worthy. The first step was during COVID, when the patients didn't have to go or collect in one place, when there was restriction on transportation, when they couldn't get into public transportation, something else. And now during war, it actually proven worthy as well, because the patients don't have to go somewhere far from the place of their residence, from their shelter, and so they can actually get this kind of care near their place of residence or shelter. Thank you.
Да, це нинішній каскад лікування нашого міста на 1 липня. Зменшення йде в абсолютних цифрах. Ви бачите, знизилася кількість людей, які стояли на обліку за рахунок того, що вони виїхали в другі міста. Але загалом процентне співвідношення отримуючих АРТ та осіб з невизначеною вірусною нагрузкою залишилося на рівні минулого року.
And so this is the longitudinal or the cascade indicators that we have of our treatment. And in absolute numbers, they are indeed a bit less, but it's due to the decrease in the overall number of population. But the overall percentage of people receiving ART and the ones that are still HIV undetectable has not changed.
В першому півріччі цього року у нас також збільшилася кількість пацієнтів з замісної підтримувальної терапії, хоча декілька пацієнтів вибуло в другі регіони, в другі інші країни, але наразі ми збільшили загальну кількість цих пацієнтів на 20 осіб, десь на 20 осіб.
We also have an increase in the OST receiving patients. So we have a few patients that have been in OST that has actually moved out due to the war and everything else. But from that moment forward, we actually have an increase by 20 people, the ones who receive OST in our territory.
Які виклики ми отримали під час війни? По-перше, це були логістичні виклики. У нас постачання препаратів йде централізовано з Києва. 70% цього препарату – це TLD. І було перервано постачання препаратів. Що ми зробили? Ми почали видавати на 14 днів усім, для того, щоб зберегти ці препарати і поставити всіх пацієнтів у рівне становище.
So one of the challenges that we faced before and during war was one of the logistics challenge, because we have a centralized supply of medicine, and 70% of all the medicines that are received are the TOD. And so in the midst of the process, there have been disruptions. So what we started to give is we started to give people only 14 days worth of medicine so that everybody would be equal, and so we don't have a disruption in their treatment.
Також було припинено постачання картриджів для визначення CD4 та вірусного навантаження.
We also have a disruption in supply of cartridges for CD4 detection and viral load detection.
Нам прийшлося вжити таких заходів, як тестування тільки дітей та вагітних, а також пацієнтів, які різко ускладнювався стан їхнього здоров'я.
So this is why we made a decision to have those means being tested or used only for children or pregnant women, or for people with rapidly increasing in severity of their cause of disease.
І остання, але дуже серйозна проблема – це порушення постачання централізованого препаратів замісної підтримуючої терапії, в результаті чого виникла загроза 675 пацієнтів були б в стані абстинентного синдрому.
And we also have, ви мали на увазі замісна чи АРТ? Тому що ви кажете абстинентний, але ви кажете РТ. Можу попросити повторити, можливо, я не розчув.
Замістительна.
Супер, дякую, перепрошую. And also there was a problem with the centralized provision of OST supply, and so we had a really big fear that 675 patients would have the abstinence syndrome because they would be off the regularly received OST. Thank you.
Здесь нам большую помощь оказал Международный альянс громадского здоровья и общественная организация 100% життя.
So here a big help was received from the International Public Health Alliance and 100% Life organization.
Они закупили препарат у производителя, склады которого находились в нашем городе, и таким образом помогли спасти 675 человек и избежать проблем прежде всего для всего города.
So what they did is they actually procured every available medicine in stock from the manufacturer on their warehouses that were located in the city. And so they helped those 675 people, and they helped our city to avoid a big problem.
Всем добрый день. Большое спасибо, что пришли на нашу сессию. Меня зовут Алла Ходок. Я представляю неправительственный сектор, пациентскую организацию 100% життя Одесса.
Thank you everybody for coming, and I represent the 100% Life Organization Department in Odessa, and my name is Alla Ходок.
Несмотря на вызовы полномасштабного вторжения Российской Федерации на территорию Украины, мы не остановили свою работу.
Despite of the open act of aggression against Ukraine from the Russian Federation, we have not stopped our work to be done.
Как за деньги местного бюджета закуплены были мультитесты, так и при поддержке с USAID были кровяные и оральные тесты закуплены.
So by the support of the local budgets, we have procured multi-tests, and also from the support of USAID, we have oral and blood drop tests as well procured for them.
Широкое внедрение тестирования на ВИЧ продолжалось не только в медицинских учреждениях.
So the wide inclusion of HIV testing has not only been included into healthcare or medical facilities, but also
в Одесскую область приехало очень большое количество переселенцев, и мы начали тестировать совместно с городским центром СПИДа на базе гуманитарных штабов переселенцев.
But also, Odessa has a lot of internally displaced people, or IDPs, coming to it, and so we have partnered with organization and started to test in the humanitarian aid hubs or centers where they've been located.
К нам присоединились врачи семейной медицины, и прямо на месте переселенцы могли подписать декларацию с семейным врачом.
We were joined in by GPs or general practitioners. So IDPs coming in, they were able to sign the contract with a GP on this spot, whatever they've been in our Western region.
При поддержке международных доноров мы продолжаем проводить обучающие тренинги по тестированию, по профилактике стигматизации в медицинских учреждениях.
So that with the support of international donors, we are still conducting trainings on the testing, on the prevention of stigma and discrimination amongst the doctors and everybody else.
Мы столкнулись с тем, что многие люди потеряли работу, и им нечего было кушать. И спасибо большое ЮНЕС, что они помогли с закупкой сертификатов на гигиенические наборы, продуктовые, на медикаменты.
And so a lot of people unfortunately face the fact that they've lost their job because of war. And so thanks to the UNAIDS and others, we were able to procure the hygiene box, or they were able to procure hygiene box, food boxes, food packs, and so they were able to still keep being alive.
В связи с угрозой Российской Федерации, что на нас будут атаки типа ядерного оружия, радиации и так далее, ЮНЕС закупил качественные противогазы для специалистов городского центра СПИДа, чтобы, если произойдет что-то, работа не останавливалась.
And so since we always have this like concern or threats from Russia with their aggressions, like we are going to nuclear strike or there's going to be radiation poisoning, UNAIDS was able to procure the PPEs or the gas masks, which will be provided to the 8 centers in case of a need, so that the work will not be interrupted.
Также достаточное количество было закуплено различной техники, чтобы не останавливалась работа центра СПИДа и неправительственных организаций. Вы на слайде видите, я не буду перечислять все.
And so there's also have been a sufficient amount of equipment procured for the 8 centers and NGOs, so that yet again the work would not be interrupted or disrupted.
Не останавливается работа при поддержке глобального фонда.
We have not stopped for a minute. The work conducted with the support of the Global Fund.
Это работа в тюрьмах с детьми, с немедицинским уходом, и любая помощь на дому, диагностика, регулярные услуги продолжают оказываться.
Which is the work in jail, non-medical support, non-medical interventions, and other things that are still ongoing and will be done after as well.
Мы столкнулись еще с одним вызовом, когда началось полномасштабное вторжение, и у нас звучали постоянно сирены. У многих людей начались панические атаки, они боялись выйти на улицу.
We have faced another problem because of Russia's intervention and their invasion to Ukraine. We have constantly have the air raid alerts, which is like an alert system that tells you that there's something going on, like a missile strike or something else. And so a lot of people develop anxiety and they're afraid to go outside of their houses or shelters.
Но социальные работники, они супергерои, и они всем пациентам, кто нуждался, приносили терапию домой. Только по городу Одессы без области было более 2000 доставок антиретровирусной терапии.
And so, but our social workers are everybody's superheroes, because when those things were happening, even by Odessa city alone, they were able to deliver ART treatment to 2,000 homes, the city alone.
Также продолжает нам помогать фонд Елены Пинчук по закупке препаратов для ВИЧ-позитивных деток.
We also have a lot of help from Elena Pinchuk Center, which helps us to procure ART treatment for children.
Спасибо большое Всемирной продовольственной программе от ООНа. Только с июля месяца около 60 тысяч больших продуктовых наборов было как для ВИЧ-позитивных людей, для ключевых групп сообщества и также для тех людей, кто пострадал в результате боевых действий.
We would also like to express our deepest gratitude for the World Food Organization from UN, which only from July, 60,000 food packages has been delivered to the HIV patients or key population groups that really needed it.
Мы столкнулись с тем, что первое время нельзя было купить медикаменты. И даже такой препарат очень важный для щитовидной железы, который гормонально надо было пить каждый день, его нигде нельзя было достать. И нам помогли наши партнеры Диакония с Германии. Они также обеспечивали ВИЧ-позитивных людей препаратами для щитовидной железы и необходимыми витаминами.
And so we have also faced a big problem from the beginning of the war that there's really been a big issue with the procurement of thyroid medication, that you would need to keep your thyroid going, and so that you have to take on daily. And so here we got a lot of help from Diakonia from Germany, which provided thyroid medication and as well vitamins that were needed for HIV-positive people with other issues.
Мы столкнулись еще с одним вызовом – это рост ковида.
We've faced another big challenge, was the growth in number of COVID-19 patients.
Нам очень помог FU. Они закупили картриджи на CD4, быстрые тесты на ковид, и это дает возможность мультидисциплинарной команде с врачом, социальным работником и медсестрой выезжать к пациентам и оказывать все услуги на дому.
And so this is what we face as a challenge, and so we help the ELF organization or перепрошую, ти підкажете назву організації ще раз?
FU.
We have the FU organization that helped us in procurement of CD4 testing and rapid testing for COVID as well, which allowed our multidisciplinary team, which consists of doctor, nurse, and social worker, to go out to the place and actually provide all kinds of services needed for the patient or the client.
В связи с регулярными сиренами и взрывами у наших многих пациенток начались преждевременные роды.
Due to those air raids, alarms, and bombing and shelling of our city, a lot of our pregnant patients have delivered premature or their delivery started not on time.
Недоношенные дети нуждались в специализированном питании, и тут пришел частный бизнес, такой как магазин «Антошка», и они помогали нам, закупали, передавали детское питание и маленькие памперсы нулевка.
And so premature babies need special support by means special nutrition and other things. And so here private business stepped in, like this store called Antoshka store. They have bought like special nutrition and actually diapers for premature babies.
Также нам помогал USAID, они также давали продуктовые сертификаты гигиенические.
We've been also helped by USAID, who've given us food and hygienic product certificates that you could procure them for.
И благодаря поддержке ЮНЕЦа сегодня оказана также различная помощь в виде медикаментов и сертификатов для потребителей инъекционных наркотиков.
And also due to the support of UNAIDS, we have a support for medicines and other things for the injectable drug users that can also get a support from that.
К сожалению, не получилось нашим друзьям, коллегам и партнерам приехать с Киева, потому что в день выезда они попали под ракетный обстрел.
Unfortunately, our dearest friends from Kiev were not able to make it here, since the day when they were trying to leave Kiev, they were under the bomb shelling.
Но благодаря техническим возможностям они подключатся к нам онлайн.
But thankfully, most of them are safe, and they will be able to join us online here and now.
So I would like all of us to say thank you to this brilliant panel. Thank you for this presentation. And the next our speakers, it's our Kyiv. So they couldn't come, as Ala told, and they have right now problems because of Russian airstrikes the 10th of October, because its center and office of our organization do not have windows and doors anymore. But thanks God, everyone alive and healthy, and they are able to join us online. So we will have today presentations from Dr. Elena Martinenko, Kyiv Municipal AIDS Center Director, and Mrs. Elena Svetyuk, 100% Live Kyiv Region, Head of the Board. Martinenko Elena is Head of Outpatient Clinic of the Kyiv City AIDS Center. She has education and specialization in infection diseases and epidemiology. She joined team of Kyiv AIDS Center in 2008 as infection disease doctor, and in 5 years she became a head of outpatient clinic for the Kyiv City AIDS Center. She's an administrator, but she's still seeing patients with the most serious cases. In 2021, Dr. Martinenko was leading a team of Kyiv City AIDS Center to draft municipal public health program and HIV-related activities for 2022 into the Health of Kyiv Citizens program. And Mrs. Svetyuk Alena, she head of board of 100% Life Kyiv region. She has extremely solid background for management HIV service organization with multi-million budget. She has a higher education in social pedagogic and economy. For 7 years, she was engaged in government sector management of social services for youth. From 2011 year, she joined civil society sector and immediately gave up to HIV response. Ms. Alena joined 100% Life Kyiv region as a program director, and last year she was elected as a head of the board. Alena represented people living with HIV community in Municipal Coordination Council and coordinating civil society organizations initiative group in Coordination Council. So, Dr. Martinenko Alena, you are welcome.
Лера, Мартиненка Олена немає.
Okay, we don't have Martinenko Alena, so all the presentation will be provided by Svetyuk Alena. Alena, welcome.
Да, доброго дня всім, рада всіх вітати. Дійсно, ми не змогли доїхати до конференції особисто, але це нам не заважає прийняти участь онлайн. Олена Мартиненко вибачається, тому що в понеділок під час обстрілів Російська Федерація пошкодила повністю СНІД-центр Київський міський, пошкодила один із наших офісів. І саме тому зараз вона перебуває там на місці. Ось, я попрошу вивести презентацію, якщо можна. Я розпочну.
Одну секундочку, я залюбки перекладу все, що
Так, перекладіть, будь ласка.
сказали. So greetings to everyone and happy
We cannot hear translation. So you are muted. Лена, можешь включить свой микрофон? Ми тебе не чуємо. So I think we have small technical issue. Let's move on, maybe, and when it will be fixed, we can hear Alena. So я пропоную зараз зробити маленьку паузу для Києва, і в цей час ми надамо слово Дніпру. Добре? Доки ці технічні питання будуть вирішені. So, we have another presentation, Municipal AIDS Response and Cascade of HIV Services in Military Conditions, one IDP's patient story. We have two presenters here, Dr. Tatiana Martinenko, Senior Specialist for the Dnipro Municipal Health Department, Oksana Belousova, Head of the Dnipro Municipal Department on Social Policy and Child Protection. Dr. Tatiana Martinenko, she's Senior Specialist of the Primary Health Unit of the Dnipro Municipal Health Department, Secretary of Municipal Coordination Council on HIV, AIDS, Tuberculosis and Drug Dependence. Family doctor by education, Tatiana has been working in its capacity for 12 years. She met her first HIV-positive patient as the first month of her service and organized follow-up from confirmation of diagnosis to treatment adherence. Since signing of Paris Declaration, Tatiana was nominated by City Mayor as a focal point for the implementation of Fast-Track City initiative in Dnipro. She was a main writer of the municipal FTCI program and roadmap to achieve FTCI target. And we have Oksana Belousova, the head of Child Protection Unit of the Dnipro Municipal Department of Social Policy and Social Protection. She has a master's degree and she has a degree in law and in economics. Her education background and personal commitments helped to strengthen municipal efforts to eliminate mother-to-child HIV transmission and ensure social protection of mothers and children living with HIV. So let's start with the presentation. The floor is yours.
Доброго ранку. Я буду розмовляти рідною мовою.
Good morning, and I will continue in Ukrainian, and we also have online. І також у нас відновилось доступ до мікрофонів, в разі чого.
Презентація. 24 лютого 2022 року життя українців розділила на до та після. До вашої уваги хочу розповісти про історію однієї людини у цій війні. Жінка, 51 рік, була евакуйована із містечка Донецької області у червні 2022 року у зв'язку з бойовими діями на сході України.
So first of all, thank you so much, and I would just like to tell you a story that there was a woman, 51 years old, who was evacuated from the small town from Donetsk region in June 2022 due to the hostilities in the east of Ukraine.
Коли жінка прибула до нашого міста, на фоні стресу в неї виник опорізуючий лишай важкої форми, і її було госпіталізовано до лікарні.
So due to this high level of stress, unfortunately, the lady had the herpes zoster infection, and she was hospital, or shingles essentially, or she has been hospitalized to the hospital as a result of stress.
В лікарні, враховуючи хворобу, вона була обстежена на ВІЛ-інфекцію, і результат був позитивним. Коли вона перебувала в лікарні, вона отримала лікування від опортуністичних інфекцій та інших хвороб і вже отримала, було призначена антиретровірусна терапія.
And so during her stay in the hospital, she actually have been tested for HIV and other opportunistic or side infection essentially, and she has been enrolled to the treatment program for both her infections and HIV as well.
Після виписки з лікарні жінка дуже переживала, що вона мешкає разом з іншими евакуйованими чужими для неї людьми, і які дізнаються про її хворобу, адже вона приймала багато ліків. Для неї за співпраці з представниками громадських організацій було знайдено місце в шелтері, в якому мешкають представники уразливих груп. І окрім цього, вона отримала гуманітарну допомогу у вигляді харчових наборів, засобів гігієни, які для неї були дуже доречні у цей складний для неї період. Враховуючи, що її донька на той час евакуювалась до Польщі, було розроблено маршрут для подальшого лікування антиретровірусною терапією в Польщі, передані контактні дані медичних установ та громадських організацій, які співпрацюють з ВІЛ-інфікованими у цій країні. Що залишилось за кадром в цій історії цієї людини? Це була сумісна робота військових, поліції, медичних працівників, адміністрації міст щодо евакуації людей. Розселення евакуйованих в прихистках в приватному житлі. Реєстрація внутрішньо переміщених осіб в управліннях...
Колеги, вибачте, будь ласка, я внедряюся, Лера, Попроси, будь ласка, якось організаторів, вони перекладача виключили із зустрічі взагалі. Хост виключив його із зустрічі взагалі. Dear host, if you are listening to us, please give the permission to our translator, Владислав Зволь. You switch him off the meeting. Thank you.
Продовжувати. Реєстрація внутрішньопереміщених осіб в управліннях соціального захисту, отримання грошової допомоги і допомога в працевлаштуванні. Доступність медичної допомоги переміщеним особам. Доступність тестування на ВІЛ-інфекцію в умовах війни. Лікування опортуністичних інфекцій за рахунок бюджетних коштів. Короткий шлях пацієнтку для отримання АРТ і постановку на облік. Також була проведена робота психологів з людьми, які вперше виявлено ВІЛ-інфекцію, профілактика відчуття ізоляції, виявлення страждань та страхів людини.
So one of the things that have been mentioned before there was a technical issue is that after being diagnosed from the hospital, the lady was really worried because she had been living in with the places with evacuated people and the shelters and so on and so forth. And she has to take a lot of medication, and therefore she was afraid that she would be exposed or something else. And thank you to the cooperation between the municipality and the civil society, the lady has been provided with a needed accommodation for the key population. In addition, she has received the humanitarian aid, food and hygiene kits, which were appropriate and needed in her situation. And since she has been infected, she has joined with her daughter, who has a temporary residency in Poland, and she was provided with all the necessities and all the needed recommendation information, medical institutions, so that she has her medical data with her. Recommendation has been taken. Now she's been supported and provided ART and care for as one of the Ukrainian refugees living in Poland. And so a few of the things that also have been mentioned is that there has been a lot of joint work conducted before. There has been joint work with military, police station, medical employees, city administration, to evacuate people from the war zones or places directly affected by the conflict. There was resettlement of IDPs in shelters and private housing as well, because there has been a huge influx of them. There has been registration of IDPs in the Department of Social Protection and Social Affairs, and most of them have been provided with the financial assistance. We were trying to ensure accessibility of medical care for IDPs as well. The treatment of opportunistic infections or side infections with HIV was done at the expense of the local budget or municipal budget in that specific case of the city. The psychological support and care has also been provided for the people who were diagnosed with HIV infection at that time, and there was also an assistance yet again for accommodation for IDPs from key populations who are being HIV infected. Thank you.
Допомога в пошуку місця мешкання для осіб уразливих груп, надання гуманітарної допомоги, харчових наборів, засобів гігієни, одягу і громадськими організаціями Департаментом соціальної політики. Робота лікарів кабінету «Довіра» в напрямку створення індивідуального плану лікування пацієнтки, в тому числі вирішення питання подальшого лікування за кордоном, співпраця з громадськими організаціями різних країн.
So one of the things that have been happening is the provision of humanitarian support and assistance for all the internally displaced people in terms of food packages or kits, hygiene packages or products. A lot of NGOs and a lot of other organizations like municipal department, social protection units have been at work here. The work of those Dovira centers or Dovira rooms that have been referred before, like trust cabinets, for creating an individualized treatment plans or treatment schedules or schemes for the patients, including a potential options for the treatment abroad, also in cooperation with the public organization from a lot of different countries.
Перерозподіл лікарських засобів в межах області та перенаправлення потоків пацієнтів для отримання АРТ, адже лікарські засоби в зоні бойових дій були заблоковані або знищені.
There has been also a redistribution between the oblast or what's so-called regions in Ukraine and redirection of IDPs and patients flow, so like the patients among the internally displaced people have been redirected because some of the stocks of the medicines in the affected area have been damaged or blocked or destroyed. Therefore, not everywhere in Ukraine geographically were equal in access to medication.
Можливість роботи медичних установ навіть в умовах відсутності світла, опалення, мобільного зв'язку та інших екстремальних умов, що стало можливим завдяки команді 100% життя за фінансової підтримки UNAIDS. А саме, наші заклади, які надають послуги ВІЛ-інфікованим, отримали генератори, паливо, комп'ютерну техніку, рації для зв'язку, обігрівачі, вироби медичного призначення, медичні ноші, вогнегасники, каністри для збереження води та багато іншого.
There has been tremendous effort put in place for medical institutions to be able to continue to operate even in the absence of electricity, heating, water supply, communications, and something else, or other extreme conditions. It was all only possible due to the support from 100% Alive Dnipro and UNAIDS financial support. So a lot of the financial institutions or facilities have been able to provide their services because they have gained their access to the power generators, fuel, computers, radios, communication equipment like heaters, water heaters, medical products like stitches, and so on and so forth, and more can be seen on this slide.
Місто Дніпро продовжує боротьбу з ВІЛ-інфекцією, незважаючи на війну. І ми віримо в нашу перемогу не лише у війні, а й у боротьбі з ВІЛ-інфекцією.
So despite war and everything else that's happening, the Dnipro city continues to relentlessly fight the HIV and combat HIV infection. And we believe in our victory, not only in this war, but also over HIV. Thank you.
Hello, my name is Oksana. I'm working in Department Social Politics. Я продовжу на українській мові презентацію нашого міста. Надання соціальної допомоги, соціальних послуг незахищеним категоріям населення завжди перебуває в центрі уваги керівництва міста Дніпра та Департаменту соціальної політики. У місті працює система соціального захисту населення, до якої входять відповідні управління, територіальні центри, центри соціальних служб, установи надання соціальних послуг, такі як соціальний гуртожиток, центри підтримки дітей та сімей тощо, які надають допомогу вразливим категоріям населення. Зокрема, це особи, які опинилися у складних життєвих обставинах, внутрішньо переміщені особи, постраждалі від домашнього насильства, або які вчинили насильство, теж потребують допомоги, відбули покарання у вигляді обмеження або позбавлення волі.
So my name is Oksana, and I'm from Social Policy Department in the city of Dnipro, and we have a lot of projects and programs and facilities that are helping people with different means necessary. And so there are social services provision for this. The whole city has the social protection for the population group, and it has many departments, and those departments have territorial centers, and the parts of the city do provide the social support. And there's a lot of things provided for a lot of vulnerable groups of population. And among the vulnerable groups of population, there are people with difficulties, for example, like the ones who've been internally displaced, the victims of domestic violence, gender-based violence, and people released from prisons. And regarding the violence, those were one who were suffered and also who inflicted acts of violence, just because all of them are in need of protection and help and care. Thank you. Будь ласка, меншими частинами.
У місті Дніпро успішно реалізуються програми, спрямовані на надання різних видів адресної допомоги, надання соціальних послуг різним категоріям громадян міста. Так, для реалізації проходження особами, які вчинили насильство, відповідних корекційних програм згідно чинному законодавству України, заходами комплексної програми з питань сімейної гендерної політики та демографічного розвитку, попередження насильства в сім'ї та протидії торгівлі людьми на 2023-2027 роки прийнято рішення міської ради. Прийнято рішення міської ради, передбачено здійснення соціального супроводу жінок та чоловіків, які вчинили домашнє насильство.
And so for the city of Dnipro has a lot of programs targeted for assistance for provision of social services for different population groups. For example, city implementation and correctional or correction programs for both perpetrators of violence, for those who have been under violence and given violence, and also program for prevention of domestic violence, programs for prevention of human trafficking, and also the city addresses the implementation of all those programs for family, gender-based violence, and other things. And so from 2023 to 2027, we have approved a social support program both for men and women and other people as well.
Також рішенням Дніпровської міської ради прийнято комплексну програму соціального захисту мешканців міста Дніпра на 2022-2026 роки, яка спрямована на забезпечення гідного рівня життя особам, які на законних підставах мешкають у місті Дніпрі, шляхом надання додаткових місцевих соціальних гарантій у вигляді пільг, різних видів адресної допомоги, залучення їх до активного життя, проведення заходів та надання соціальних послуг. В рамках програми реалізується надання фінансової підтримки інститутам громадського суспільства для виконання соціальних програм або проєктів для міста на конкурсній основі.
And so the City Council has also adopted a comprehensive program for social protection of its residents that's working from 2022 till 2026, which is also dedicated to ensure a good or valid or adequate standard of living by providing additional social guarantees in forms of different types of benefits, various types of targeted assistance, involving them in the physically active life, holding events, and providing social services within the program. Financial support and like a compensation can also be provided to the public organization for the implementation of social programs by the municipality. So it's done like a competition. So there's a competition for the social programs or social organizations, and the ones that win will receive financial grants from the city council.
Вирішення соціальних питань та надання соціальних послуг неможливо вирішити без тісної співпраці з громадськістю, організаціями та фондами. Департамент соціальної політики Дніпровської міської ради у тісній співпраці з державною установою Центру пробації та громадськістю з метою організації соціального патронажу, надання соціальних послуг здійснює за потреби соціальний супровід осіб молодіжного віку, дітей, які перебувають у конфлікті з законом, та осіб, які відбули покарання у вигляді обмеження або позбавлення волі.
So regarding the solutions to a lot of the social problems and issues, and how to provide the social services, it is really hard to be done or even close to impossible without the cooperation with the regularly represented civil society. The Department of Social Policy of Dnipro City Council mentioned before, and where I reside, is in close cooperation with the types of institutions, which one of them is called the Probation Center. And the civil society actually provides social support to young people and children in the conflict-affected areas with the both in person and remotely, and is serving, and for people who are serving their sentences in form of restriction of their movement, so like the restrictions of like they can't leave apartment or something, or even if they are imprisoned.
Одним з прикладів позитивних результатів такого співробітництва є взаємодія Департаменту соціальної політики та благодійної організації «Благодійне товариство 100% життя Дніпро», в рамках якого цієї організації було отримано фінансування від Дніпровської міської ради на суму 294 тисячі гривень. Це був проєкт зниження стигми та дискримінації представників уразливих до ВІЛ-ключових груп та суб'єктів пробації в умовах епідемії COVID-19. Також 48 тисяч – це був проєкт психосоціальний супровід 60 жителів міста Дніпра серед ключових та вразливих груп населення. Загальна сума фінансування склала близько 343 тисяч гривень. На даний момент проведено 4 тренінги із зниження стигми та дискримінації представників уразливих до ВІЛ ключових груп та суб'єктів пробації в умовах епідемії COVID. Для надання офіцерів пробації, 2 для офіцерів пробації, 2 для медичних працівників системи міського охорони здоров'я. 200 суб'єктів пробації отримали послуги із скринінгового тестування та соціального супроводу. 60 пацієнтів, це жителі міста Дніпра з уразливих ключових груп, які перебувають на лікуванні, пройшли безкоштовне обстеження методом КТ-МРТ. Обидва проекти на даний час вже завершені.
So we have a lot of examples of cooperation to be present, and one of which was between the Department of Social Policy from yet again Dnipro City Council and the charitable or NGO charitable organization 100% White Dnipro Department. And so this cooperation has allowed to receive the funding from the Dnipro City Council in the amount of 294,600, which is around, I think, $10,000 at that time and like $6,000 to $7,000 this time. The project reducing stigma and discrimination against the key population and participation of probation system in the context of COVID-19 pandemic. And this project was also providing psychosocial support to 60 residents and the key population. The total amount that was summed was 343,400 hryvnias. Ukrainian hryvnia is the currency of Ukraine. And also there have been trainings conducted on reducing and stigma and discrimination. And so the two of the probation officers and two for the probation officers and two for the healthcare workers. So all in all, 200 participants of the probation have received testing and social support. And so overall as well, 60 patients from the key populations who were undergoing treatment underwent a free examination by performing a CT scan, MRI scan, and both projects have been fully completed as of now. Thank you.
Також благодійна організація «100% життя Дніпро» постійно співпрацює з комунальним закладом Дніпровський міський центр денного перебування для ВІЛ-інфікованих дітей та молоді Дніпровської міської ради щодо здійснення медико-соціального супроводу ВІЛ-інфікованих дітей та молоді, проводить тренінги, терапевтичні заняття для сімей, у яких виховуються діти цієї категорії. Також залучається до багатьох інших активностей.
And so also charity organization 100% White of Dnipro, or Central Dnipro Department, also cooperates with the Dnipro City Daycare Center for HIV positive children and youth of our city council. And so they conduct training, therapeutic classes, therapy classes, and for families and children, different events are being held, like art therapy and other things are being conducted.
При фінансовій підтримці Fast Track City та за сприянням керівництва міста Дніпра в межах реалізації проєкту «Підтримка послуг з лікування та догляду людей, які живуть із ВІЛ» у рамках проєкту Fast Track City Дніпро в контексті війни в Україні благодійною організацією «100% життя Дніпро» відкрито шелтер у місті Дніпрі для внутрішньо переміщених осіб, таких як жінки, матері з дітьми, із числа ключових уразливих верств, які опинились у складних життєвих обставинах.
So within the financial support and under the leadership of Fast Track Cities and with the leadership of Dnipro City Municipality and the Council, with the unfunded project support for treatment and care for people living with HIV in the context of war in Ukraine, and with charitable organization 100% White Dnipro, they've opened a shelter for internally displaced people, which have been women or mothers with children, for the groups of key populations to be able to reside there if they happen to be internally displaced as well.
Однак соціальна робота на цьому не закінчується, та сподіваюсь на близьку перемогу та тісну співпрацю з громадськими організаціями надалі. Дякую.
But still, the social work is not ended, it's not ending, and it's never will be ended. So we are hoping for the war to come to an end as soon as possible, and we are hoping for as tight of cooperation as possible with the NGOs and other organizations. Thank you.
Thank you so much. Thank you for this very interesting presentations, and let's give a second try to Kyiv. I think everything already fixed, so we are welcoming again Alena Svetyuk, Zoom presentation.
Да, колеги, доброго дня ще раз. Я маю надію, що мене чутно.
О, чутно, але не видно.
Ага, чому не видно? Це спитайте у організаторів.
Зараз, хвилиночку. О, вже і чутно, і видно. Тобто, Олена, welcome.
Да, welcome. Доброго дня ще раз. Скажіть, будь ласка, можна мою презентацію вивести на екран, щоб ви її
Зараз
всі бачили?
презентація, presentation number 2.
Дякую. Я почну розповідати вам про те, як місто Київ реалізовував основні завдання фаст-треку під час активних бойових дій, які відбувалися поряд із Києвом. І попрошу другий слайд.
So, well, first of all, welcome everybody, and thank you so much for bringing up my presentation. And I will tell you the activities that Kyiv has implemented within the Fast Track program. And also, please turn on to the second slide.
Коли Російська Федерація почала активну бойові дії проти нашої держави, ми зіткнулися з тим, що ніхто нас, в принципі, ніколи не вчив, як працювати, коли літають бомби і коли по тобі стріляють, і що робити.
So when the war has been started by the Russian Federation, and nobody has taught us on like what to do and how to act when you're being bombed, when there's rockets flying across your head or something else. So we didn't have the information.
24 числа ми стикнулися з тим, що реально всі були в якомусь ступорі психологічному, тому що ніхто з нас не розумів, що нам і як діяти далі.
So on the 24th of February of this year, everybody was just like phased out or outed completely. They did not know what to do, how to do, and how to act.
Перше, що ми зробили, це те, що зробили штаб на базі нашої організації, куди могли надходити всі дзвінки з усього Києва і Київської області, людей, які потребували допомоги.
And so the first thing that we did, we created a headquarters and a hotline for Kyiv and the Kyiv region so that everybody who needs help can actually call us and say what their request is or what they actually need to be helped with.
Ми об'єднали якби мультидисциплінарну команду на базі нашої організації. Центр СНІДу, ТУП-службу і взагалі повністю КМДА.
So we have merged essentially into one big multidisciplinary team, the AIDS Center, the TB services, and the city console.
Нам вдалося завдяки цьому налагодити роботу і не опустити руки. І ви можете побачити на першому слайді, це наше досягнення за останні 3 роки і 6 місяців 2022 року. Тобто кількість людей, які знають про свій ВІЛ-статус, кількість людей, які отримують АРТ, і повне нове вірусне навантаження. І ви можете побачити, що навіть незважаючи на те, що у нас були активні бойові дії, показники у нас зростали.
So and here we did not let our hands down, we did not stop doing everything. And so right now you can see the indicators on the number of the people for the past 6 months of 2022, like people that know their status, people on the ERT, people knowing their viral load. And so even with the active warfare, we did not stop, we continue to do so. When you see that the indicators did not drop.
Я хочу зауважити, що, безперечно, це завдяки тим напрацюванням, які були зроблені останніми роками.
I would just like to note that this is due to the line of work and the achievements that we have done in the past few years that this was possible.
В рамках реалізації самого фаст-треку. Наступний слайд, будь ласка.
Next slide, please.
Ви можете побачити, що у нас відбулася децентралізація надання наших послуг РТ. В 2016 році ми мали тільки 4 сайти, які видавали РТ. В 2022 році, незалежно від того, від тих бойових дій, які відбувалися біля міста Києва, ми маємо 40 сайтів видачі РТ. На діаграмі ви можете подивитися, що навіть приватні лікарні у нас почали видавати РТ. Ми вийшли в свій час на мережу аптек, що дало змогу лікарям-інфекціоністам виписувати рецепти, і пацієнти мають змогу отримувати АРТ в аптеці близько до свого місця проживання.
So, and this is the framework that we have, and this is all because of the fast track program and organizations that we did before. And so we have done the decentralization of ART provision. So before on the map, we only had like 4 sites for ART. And so in 2022, independently of the fact that we had war and active war action, we have 40 ART sites. And on the diagram, on I guess the previous slide, you could see that we have those 40 centers, and we also started to but provide ART services through the private hospitals. And also we have been in contact with the pharmacies. And so for pharmacies, for infectious disease doctors, for him to have a prescription done for ART, and for like a network of pharmacies to be able to provide medication or ART to the patient if they come there, so that it will be nearby where they live, and it will be as accessible and approachable as possible. А я вас м'яко прошу меншими шматками.
Ще раз прошу.
Ну, меншими об'ємами, будь ласка, по декілька речень.
Все добре, дякую, я просто заговорилася. І завдяки саме цьому нам вдалося зберегти, ну, скажімо так, мережу видачі АРТ під час активних бойових дій.
And due to that, we were able to preserve the ART provision network, even though we had an active warfare happening a few kilometers away from us.
Наступний слайд, будь ласка.
Next slide, please.
Що стосується поставок АРТ і кількості взагалі людей, які отримали АРТ.
Regarding supply chain of ART, a number of people in ART.
Я хочу тут зазначити, що місто Київ видачою АРТ окупило не тільки місцевих мешканців, а і людей, які приїжджали до міста Києва, і ще і Київську область.
So I would just like to mention that Kyiv City provided ART not only from the Kyiv City citizens, but also for all the IDPs coming, internally displaced people coming, and also for the whole region that surrounds the Kyiv City.
І тут я хочу сказати велике дякую лікарям Київського міського центру СНІДу, тому що вони в період активних бойових дій, тобто з 24 лютого по майже кінець березня 2022 року, просто жили на роботі.
And here I would just like to bow deeply and express my deepest gratitude to the doctors of Kyiv Aid Center, since from 24th of February to the end of March of 2022, they actually lived and stayed at work because of the warfare that was happening so nearby, and they were still conducting their work.
Наші соціальні працівники, вони так само 24/7 надавали послуги пацієнтам, тим людям, які цього потребують.
So our social workers in the same manner 24/7 provided services for the patients that really needed them.
Ми стикнулися з міграцією. Пацієнти почали виїжджати з міста Києва, а інші пацієнти почали заїжджати до міста Києва.
So we faced a lot of the migration things. For example, a lot of people moved out of Kyiv, and a lot of people moved there as IDPs later on.
І це дуже важкі процеси, тому що ми мусили, як і лікарі, так і соціальні працівники, обслуговувати в 2-3 рази більше людей, ніж до цього.
And this is hard for many reasons, but the fact is that both social workers and doctors had to serve for twice as many people as before due to this migration.
Наші лікарі і наші соціальні працівники працювали не тільки з тими пацієнтами, які станом на сьогоднішній день перебували в Україні, а ще й з пацієнтами, які виїхали за кордон і потребували підтримки за кордоном.
So I would also like to commend our doctors and social workers that they didn't only work with the patient who have moved in Ukraine, but they also worked with ones who moved abroad and still required some services to be provided.
Ми змушені були вийти з наших кордонів, мається на увазі з того звичного середовища, де ми працювали, вийти на організації, які за кордоном почали допомагати нашим пацієнтам отримувати там АРТ.
So we had to get out of the borders ourselves, and when borders, I mean the comfort zone that we have, and so we had to get in touch with the organization abroad so that they could be in contact with our patients and help them receive ART services there as well.
Але незалежно від того, де знаходився пацієнт, він отримував свою допомогу. У нас були пацієнти, які знаходилися в гарячих точках, саме там, де перебували російські військові.
But no matter where the patient has been, we did our best and everybody else did their best for them to receive the services. But some patients have been in the war zone area or at the axe point. Essentially, this is where specifically Russians have been in or have occupied.
Наші соціальні працівники здійснювали доставку АРТ на непідконтрольній території українській владі.
Our social workers actually delivered ART treatment to the government uncontrolled areas, so where it was occupied.
Наступний слайд, будь ласка. Ви можете побачити на цьому слайді, я не буду коментувати, які були основні загрози переривання лікування АРТ.
So on this slide, you can actually read it out yourself, and so it presents the main issues with the disruption of the ART for the patients that have been there at this specific pieces of time period.
Але той психоемоційний нестабільний стан як наших пацієнтів, клієнтів, так і соціальних працівників і медичних працівників, він зіграв і свою роль в наданні послуг соціальних і медичних.
So, but this deep and psychologically emotional state that really enables the patient and the social workers to actually, like, it had played such a big burden and role in the services provision, like the toll that their emotional and psychological well-being had.
Я не буду вам розповідати, що все у нас було дуже хорошо. Насправді зовсім не так. Була частина соціальних працівників, які дійсно в перші дні війни виїхали за межі міста Києва і Київської області. Була частина медичних працівників, які так само, рятуючи свої сім'ї, виїхали за межі міста Києва, і це призвело до дефіциту кадрів.
So I'm not going to say that it has been all like flowers and cookies and wonders and good. It's been hard because a lot of like the social workers as well, they moved out of Kyiv city at the beginning of the war, so we were short-staffed from that moment onward.
Ми стикнулися з тим, що ми змушені були шукати різні можливості і об'єднувати навколо себе, мається на увазі навколо міста Києва, різні можливості, які дають нам змогу, давали нам змогу працювати з нашими пацієнтами, клієнтами.
So we were first to look at other opportunities and how to work with our clients in the city and the areas surrounding it.
Наступний слайд, будь ласка.
Next slide.
І тут ви зможете побачити, що саме допомогло втримати ЛЖВ на лікуванні. Безперечно, це самовідданість персоналу, те, що я казала, що вони постійно були на роботі.
So here are the things that actually helped us to keep people living with HIV and the ART. And the first and foremost, this is the dedication of medical personnel that I have commended before.
Я не знаю, чи знаєте ви, що таке, коли в тебе 24/7 постійно дзвонить телефон і ти постійно на телефоні, але насправді навіть дуже психоемоційно стабільна людина цього не витримає.
So I don't know if any of you are familiar with what it's like to have 24/7 the phone is ringing on the wall or something else. But even for a really stable, emotionally, psychologically person, this is a enormous toll.
Тому що, крім того, що у тебе телефонують твої клієнти, пацієнти, яким потрібно лікування, і вони в паніці, і ти мусиш їх заспокоїти, переконувати, що лікування є, і вони його отримують, ти ще маєш думати про себе, про свою сім'ю, яка, можливо, і в більшості випадків не була поруч з тобою, а навіть у нас є такі випадки, коли сім'ї перебували в окупації.
So we also had like cases, if you can only imagine, people calling in despair with problems, issues, and whatnot, and there was the fears of disrupting the ERT, and when they're being under the occupied territory, and so like you can only imagine what horrors have we heard and we've been through.
І тут я хочу сказати велике дякую повністю всім організаціям громадським, всьому сектору, який працює в місті Києві і Київській області, всім державним закладам і медичним закладам, які підтримували одне одного в найважчу хвилину.
So here I would just like to really express my deepest gratitude for all the support sector that have been playing a role in these hard times in Kyiv and other parts connected to it, because this really has been a big load and a big toll and a big burden, but we all managed to go through this together. Thank you.
Наступний слайд, будь ласка. Ми жодного пацієнта не залишили без своєї уваги, жодного клієнта. Опіоїдна замісна терапія в місті Києві. Ви можете побачити, що у нас зросла кількість пацієнтів на ЗПТ.
So we have not left any person without any care support. You can see that for people on the OST, we have an increase in number of people who receive OST, I beg your pardon, and that in Kyiv City.
І саме на державних програмах замісної підтримуючої терапії.
And especially in the state program for the OST.
Чому саме державних? Тому що приватні сайти ЗПТ, коли почалися активні бойові дії, випарувалися, закрилися і залишили своїх пацієнтів на призволяще.
You may ask us, and will be righteously so, why do you say public, not private? It's because when the war started, the private centers had evaporated into the thin air, and they were not providing help or support, and so there's only the public ones that were still operational and still working.
І державні сайти замісної підтримуючої терапії перейняли на себе весь той масив, об'єм клієнтів, яким потрібна була терапія.
And so the public ones have actually taken upon themselves all those people who needed OST and did not came to them before, so you can imagine the load that they had.
Це було дуже важко, тому що навіть на державних сайтах замісної підтримуючої терапії не кругом були наявні лікарі.
Which was especially hard because even on the state OST sites, there has not in all the places been present a medical professional or a doctor.
Можливо, не можна це казати на таку велику публіку, але я скажу, що наші соціальні працівники допомагали клієнтам і самі видавали замісну підтримуючу терапію, беручи на себе таку відповідальність.
So I don't know if this is the right place to say this, but our employees have actually taken the responsibility upon themselves to provide their patients with the ERT and other things, even though if the doctors or other people were not available.
Тут мені вже пишуть, що в мене вже час, і мені потрібно закінчувати, тому я попрошу перейти через 3 слайди, і я хочу показати, як нас підтримували наші міжнародні партнери, і подякувати в першу чергу UNAIDS, тому що в найважчий час це перші, хто протягнув нам руку допомоги.
So I know that I'm a little bit over time, and so I just like to express my deepest gratitude to UNAIDS and other organizations that really helped us. And so UNAIDS has been one of the first ones to reach out to help us and ask us whether we need some kind of support.
Завдяки саме нашим партнерам ми змогли забезпечити наші ЗОЗи електрогенераторами, побутовою технікою, медичним обладнанням, всім тим необхідним, що їм потрібно було в цей такий важкий час.
So just because of UNAIDS, we were able to provide with healthcare facility with generators and other things that they so desperately needed in the times like this.
Більше того, я хочу сказати, що у нас так само працювали шелтери. Шелтери для ЛГБТ-спільноти, шелтери для споживачів ін'єкційних наркотиків, шелтери для працівників секс-бізнесу.
So I just also like to mention that we still had shelters working on for the key population, injectable drug users, sex workers and others.
Ми так само дякуємо World Food Program за той об'єм величезний, який ми отримали на допомогу нашим клієнтам і змогли забезпечити групи ризику і в тому числі ВІЛ-позитивних людей повністю харчуванням. І ми знаємо, що принаймні найближчі 2-3 місяці вони не будуть голодувати.
So we are also thankful to everybody who helped us with provision of the food and hygiene products to them, because we know that because of all the support that's given and received to the people and the key population and HIV positive will not starve to death in the next few months, 1 or 2 months.
Я маю надію, що всі ви отримаєте нашу презентацію, ви зможете ознайомитися з нею більш детальніше, але я хочу, щоб ми відкрили з вами третій слайд з кінця.
I hope that every one of you will be able to get the
Там, де ви зможете побачити,
so the slide, the cert from the end, so on that slide, the cert from the end, you will be able to see.
Там, де ви зможете, я просто не бачу слайди, там, де ви зможете побачити, що залишилося після обстрілу в понеділок міста Києва від нашого офісу 100% життя. І, в принципі, такий же самий стан в міському центрі СНІДу. Зараз станом на сьогоднішній день всі пацієнти в безпеці.
So, since the people in Zoom do not see the slides because of how the meeting room is projected, we kindly hoping that you have the slide, the cert from the last one available and present. And this slide depicts of the shelling that happened a few days ago and what's left of our headquarters 100% life. And in the same state, we have the city aid center, so you can see that the level of destruction that happened to us a few days before.
Безперечно, ми все відбудуємо і ми будемо продовжувати працювати, реалізовувати основні задачі фастреку.
I mean, we will prevail, we will rebuild, we will continue to do the main task that is requested from us.
Наступний слайд, будь ласка, і тут я хочу наголосити, що війна в Україні – це війна в усьому світі.
And here on this slide, I'd just like to mention that the war in Ukraine is actually the war in the whole world.
І якщо ми не дамо зараз належну відсіч Російській Федерації, ми будемо мати жахливі наслідки.
And so if we're not going to stop them here, the whole world will suffer tremendously after us.
Дякую всім за увагу. Якщо є якісь запитання, я готова відповісти.
Thank you so much for your attention. If you have any question, I'll be more than willing to answer if any are present.
Дякуємо, Олена. І наступна наша презентація буде від міста Кривий Ріг. So the next our presentation will be from the Кривий Ріг city, and we will have here our brilliant presenters, Sergey Malarenko, advisor to the mayor of Кривий Ріг, and Alexander Lee, head of the NGO Public Health. So Sergey Malarenko is advisor of mayor of Кривий Ріг. Prior to that, he served as the secretary of Municipal Council of Kryvyi Rih City for 14 years. Sergey provided significant assistance for Kryvyi Rih preparation for joining Fast Track Cities initiative, and now is participating in its implementation work. Thanks to his efforts, municipal, city, society organizations providing HIV services were able to receive free of charge rent for their offices and centers for service provision. And Alexander Lee, he's a head of charitable foundation Public Health Quebec Hiv. His organization has been working in the area of HIV for 16 years. Public Health is also implementing state-funded HIV prevention programs for people who inject drugs and sex workers, which is a part of National Transition Plan from donors to domestic finances. At this first months of war, Public Health initiates establishment of shelters for internally displaced people from K population. Alexander received his higher education in Donetsk city. He has diploma in journalism. So, and the first presentation will be provided by Sergei Malarenko. So, presentation number 4, please. Yeah. You are welcome.
Дякую. Вітаю вас від міста Кривий Ріг. Перший ВІЛ-інфікований в нашому місті з'явився у 1998 році. У 1993 році було зафіксовано вже 7 випадків, і в 1993 році, 10 листопада, було прийнято рішення про створення міського центру профілактики та боротьби зі СНІДом.
Thank you so much and greetings from the Quebec city. And so I'd just like to say that the first HIV infected person have been detected in 1993. And so by the November 10th of that year, 1993, we have 7 cases of HIV positive people present in our city. And so we have decided to establish an HIV prevention and AIDS care center. So essentially what we call AIDS center for our city.
У 2007 році для покращення матеріально-технічної бази центру на реконструкцію було виділено 25 мільйонів гривень. Криворізький центр СНІД отримав не лише красивий зовнішній вигляд, а й найсучасніше унікальне лабораторне обладнання.
So to improve the status of the organization and everything else, in 2007, 25 million hryvnias have been dedicated to the rebuild and reconstruction of the center, which at that time is like $4 million or something. So now, so after that, it did not only look nice, it also had the latest equipment inside of it.
В структурі центру є клініко-діагностична лабораторія та амбулаторно-поліклінічне відділення, де ведуть прийом лікарі-інфекціоністи, лікар-педіатр, лікар-гінеколог, лікар-фтизіатр, лікар-епідеміолог, лікар-дерматовенеролог.
And so in our center we have a clinical lab, we have also a few of the outpatient department, we have also the obstetrician working there, gynecologist working there, epidemiologist, infectious disease doctor, dermatologist, and other specialists related to the matter working there as well.
У 2008 році, після реконструкції центру, центр відвідав третій президент України Віктор Ющенко.
After our center had been reconstructed in 2008, our third Ukrainian president Viktor Yushchenko visited our center himself.
Початок розвитку епідемії ВІЛ-СНІДу слід вважати 96-й рік, коли у місті було зареєстровано, я не буду все зачитувати, ви все бачите на слайдах.
So the beginning of the HIV epidemic, we would say, was started in 1996, when the city had many more cases than before, and so I'm not going to go in depth on this information since most of that can be seen on the slides.
Тут показан і розвиток, як йшло, і можна зробити висновки і про роботу, і про хід захворювання. Позитивним в роботі є зниження показників передачі ВІЛ від матері до дитини 16% 2021 року до 3% 2022 року. Для покращення та приближення медичної допомоги ВІЛ-інфікованим, враховуючись протяжність нашого міста, це 126 кілометрів, створена система кабінетів «Довіра».
So one of the things that we are making and trying to improve upon, which is apart from what you can see on this slide, is that we have achieved the success in the vertical or mother-to-child transmission. Essentially, it was 16% in 2021, and it went down to 3% in 2022. And also, we made attempts to make the care closer to the population. So our city is really odd-shaped. It looks like a horn, essentially, so it's really elongated. So from the one part of the city to another, it's 165 kilometers. This is how long the city is. And so we made this dovira or trust rooms or cabinets or centers all across the city to make the services closer to the patients or the clients.
За останні 5 років активна диспансерна група у місті Кривому Розі збільшилась з 72 до 84%. Дані показники свідчать про те, що в місті наявна позитивна тенденція і досягнення стратегії протидії ВІЛ є реальною та досяжною найближчим часом та потребує об'єднання наших зусиль.
We would just like to say that our city does have a strategy to combat HIV, and we think it's achievable and attainable. It requires a lot of effort, attention, and energy and resources. Thank you so much.
Саме долучившись та підтримавши підписання Паризької декларації та проєкту Fast Track Cities Кривий Ріг, наше прекрасне та могутнє місто демонструє, що місто може суттєво змінити на краще ситуацію в сфері боротьби з ВІЛ-СНІДом, туберкульозом та вірусними гепатитами та забезпечити сталість реагування та відновити та відповіді на епідемію даних захворювань.
So by supporting the Paris Declaration and by enrolling in the Fast Track Cities, our city demonstrates that the city can change for the better in the HIV, TB, viral hepatitis prevention and combating, and continuing for of the treatment and prevention of those diseases, and so there are successes along the way.
Для цього 95% людей, які живуть з ВІЛ, повинні знати про свій позитивний ВІЛ-статус. 95% людей, які знають про свій статус, повинні отримувати лікування. І 95% людей, які лікуються, повинні мати вірусне навантаження, яке не визначається.
And so for those successes to be actually present, 95% of people who live as HIV have to know about their status, 95% out of them have to be on the ART, and 95% out of those who are on ART has to be HIV undetectable.
Мерією та УОЗ розроблено та затверджено накази по місту про створення робочої групи з питань впровадження та реалізації глобальної ініціативи Fast Track Cities та організацію заходів на виконання цієї ініціативи.
So the Mayor Council has actually established the working group on the fast track initiatives and their implementation, and so for the activities for their implementation.
Великим, зараз, це показники наші. Великим викликом для реалізації ініціативи стала військова агресія РФ проти України, проте не дивлячись ні на що, продовжили надавати послуги з тестування на ВІЛ. Хоча кількість обстежень по місту знизилась, практично стало залишатися кількість вперше виявлених ВІЛ позитивних.
So a big challenge has been this war that Russia inflicted on Ukraine. And so, but we still continued the testing services going. And so we did have a decrease in the number of tests done, but we have almost the same number of newly detected HIV positive people.
Важливо зауважити, що сьогодні 90,3% осіб, у яких вперше виявлена ВІЛ-інфекція, доведені до диспансерного нагляду та розпочали антивірусне лікування в поточному році. У 2021 році це ставило 84%.
And so I would just also like to mention that 90.3% of newly detected HIV positives were moved to the observation and outpatient departments. and they started their ART, and the last year it was only 84%, so there's this big growth that we are observing.
В умовах війни постраждали не лише люди, але й будівля Криворізького центру СНІДу. Наслідки пошкодження співробітники центру усунули самі та продовжили роботу закладу.
So the facility had physical damage that had been done to, and so the employees has actually been able to remove those damages, and so right now they're continuing to follow with their operations.
На сьогоднішній день місто прийняло біля 60 тисяч внутрішньо переміщених осіб, серед яких є ВІЛ-інфіковані дорослі та діти. Багато з них залишились без документів, що засвідчують особу, проте кожен, хто потребував безперервного антиретровірусного лікування, отримав його безоплатно і продовжує отримати на базі Криворізького центру СНІД та кабінетів «Довіра».
And so we have a lot of IDPs coming in from the beginning of the war, and so we have around 60,000 IDPs, among which there are people with HIV, there are children and women and all of that. And so a lot of them are lost their documents, don't have their documents with them that would identify them as a person, so there's no ID or passport or anything else. And so we made sure that all of them would actually get the treatment free of charge in AIDS centers or any other centers that provide the treatment.
І ще одним викликом для закладу стала мобілізація медичних працівників та навантаження на лікарів, які не покинули свої робочі місця. Постійне переривання робочого процесу під час повітряних тривог, налагодження безперервної та лікування пацієнтів, які виїхали з міста та за межі України. Велика допомога в цьому з боку Центру громадського здоров'я, МОЗ України, міжнародних організацій та соціальних працівників міста, що допомагали у вирішенні проблеми та не залишили пацієнтів без лікування.
There's a lot of other challenges that the mobilization or recruitment of medical workers, mandatory recruitment of medical workers to the army happened to the disruption of working process because of the constant air alerts, and also the treatment of patients that moved out of the city or to the other parts of Ukraine has also complicated things. This is why in all the situation we received help, and so I would just like to express my gratitude to Public Health Center, Ministry of Health of Ukraine, and also for the social workers who were helping us in those complex situations.
Наше завдання – охопити більше людей тестуванням, діагностикою на ВІЛ, здійснювати профілактичні заходи, допомагати хворим у місті Кривому Розі. Тільки об'єднавши наші зусилля і міської влади, і держави, і усіх організацій, які займаються боротьбою з ВІЛ-СНІДом, туберкульозом, ми зможемо подолати цю велику загрозу.
And so only by merging our forces and acting together as one, with all the partners hand in hand, we will be able to do the prevention efforts and do the combating efforts, and we will be able to finally win against this big threat that HIV poses.
Александр Ли. Я представляю неправительственный сектор, неправительственной организации, благотворительный фонд, клуб благодійної організації «Громадське здоров'я» міста Кривий Ріг. Всім доброго дня. Ще раз добавлю. 25 листопада 2021 року Кривий Ріг підписав Паризьку декларацію та приєднався до програми Fast Track City. Керівництво міста підтримало таку ініціативу, бо знає важливість питання ВІЛ-СНІДа у місті та сприяє роботі неправительственних організацій, Центру СНІДа і працює в дуже тісній взаємодії.
Thank you so much. I'm one of the Kryvyi Rih city representatives, and I just wanted to reiterate on a few things. And Kryvyi Rih has signed the Paris Declaration and entered the Fast Track Cities a while ago. And we supported that as the city, as the city council, we supported it by knowing how important the issues with HIV are, and that we wanted to help and be into this process as much as possible. And so
З початку війни мы столкнулись, місто Кривий Ріг столкнулся с огромной проблемой міграції населення. Город приймає людей, які змушені залишати свої домівки через війну, і всіляко їм допомагає. Це жителі Херсонської, Донецької, Миколаївської, Запорізької області. В місті майже вже більш 60 тисяч офіційного число временно переміщених осіб. Ну, по неофіційним даним їх може бути більше 100 тисяч. Більше всього потребують допомоги представники вразливих груп населення та члени їх сімей, бо вони не завжди себе комфортно чувствують в центрах біженців. І, учитывая їх привичний образ життя, вони повинні мати доступ до забезпечення базових потреб у вузькопрофільних спеціалістів, такі як СНІД-центр, сайти замістительної підтримуючої терапії. Було прийнято...
So at the beginning of the war, we have faced a really big migration of the population. We have sheltered people and helped them, the people from Kherson Oblast and other occupied or partially occupied areas from Donetsk, Luhansk, Zaporizhia, and other parts of Ukraine. And so officially, right now, we have over 60,000 IDPs or internally displaced people. Unofficially, we think that it can be 100,000 people. And so we also pay a lot of attention to the vulnerable population representatives and groups, since the regular lifestyle, they have their basic needs, and so they have to go for the AIDS centers, for example, for the OST and RT sites to receive treatment and help and care that they need.
За підтримки і фінансування UNAIDS дуже велика вдяка. Було рішено відкрити і благодійна організація, благодійний фонд громадського здоров'я міста Кривого Рога спільно з благодійною організацією «Клуб майбутнє» в червні відкрили перший шелтер. Україна – це велика родина для представників вразливих груп населення та членів їх родин серед внутрішньо переміщених осіб. Хочу додати, що був відкритий доволі в кратчайше время. В течение місяця ми змогли відкрити цей шелтер. Ще раз дуже вдячний UNAIDS.
And so by also wanting to thank you, to express my gratitude to UNAIDS, and we are grateful to the charitable organization Public Health and the Club of the Future organization, that we have opened one of the first shelters for the vulnerable population and internally displaced people in the end of the month or something, and so there's a lot more things to come.
В штаті шелтеру працюють досвідчені фахівці, які допомагають людині пристосуватися до нового життя. Психолог допомагає адаптуватися до сучасних реалій. Юрист допомагає відновленням та оформленням документів. Соціальний працівник працює цілодобово, супроводжує временно переміщених осіб до медичних установ міста. В шелтері також є дітки, які столкнулися, пережили ці бомбежки, війну, розрушені дома, які це жах, який люди приїжджають, навіть не передати словами, коли діти приїжджають і боятся любого стука, любого грюка, любой сирены, они падают просто в атаки, панические вот эти вот атаки, депрессии, из которых помогает психолог выйти им. Он ведет сучасную работу и с детьми, и также с их батьками.
And so the shelter has a line of educated personnel. Psychologists are helping to adopt, lawyers are helping with the lost documents, social workers helping with the transfer of people. Shelters has children that actually went through war, and so people are coming there with children who are actually afraid of everything, every little sound of knock, of the blow or anything else. They have panic attack, and so psychologists are actually helping them to cope for that.
Протягом червня-вересня шелтер прийняв на проживання 48 людей. З них такі категорії, як звільнені люди з місць позбавлення волі, люди, які переболіли туберкульозом, 105 человек воспользовались временным проживанием без ночевки. 13 осіб скористувалися послугами юриста для відновлення документів. 150 осіб отримали консультацію психолога. Более 100 человек было перенаправлено до протитуберкульозного диспансера для діагностики, з яких 6 осіб на даний час проходять профілактичне лікування. 153 особи пройшли тестування бистрими тестами на ВІЛ, СНІД та вірусний гепатит С. 48 людей було супроводжено соціальними працівниками для оформлення довідки временно переміщеної особи. 20 людей супроводили до сімейного лікаря для підписання декларації. 5 дітей отримали консультацію та допомогу педіатра. Благодаря підтримке Міжнародного благодійного фонду «Альянс» было выдано более 500 наборов гуманитарной допомоги непосредственно уязвимым групп населения. Благодаря благодійній організації «Фрізон» было постачання гуманітарної допомоги, средств гигиены, продуктов питания в места лишения свободы. Також благодаря благодійной организации TB People люди, которые переболели туберкулезом, получили продуктовые наборы в виде сертификатов. Це ще раз доказує те, що об'єдналися всі організації, всі, які тільки можливі. Разом нас просто не подолати в такий час.
So, we had a lot of things and a lot of services have been provided, and we have also worked with the imprisonment places, TB survivors, and we have 105 people that are staying in the shelters but are without staying the night. We have 100 encounters with the lawyers for 2 people to restore their documents. We had 150 encounters with a psychologist, and we have 6 people that went for a lot of people went for TB diagnostics, and so 6 people right now are being treated from tuberculosis. We have conducted 153 rapid HIV tests and the viral hepatitis C test. We have 48 social workers who help. We have 48 encounters with social workers who help the people to get their IDPs registration and certificate passed. We have 20 contracts signed by the people with the general practitioners or doctors so that to have their primary care services provided. 5 children have actually went to pediatrician, and so with all the support, with the alliance support, with they received 150 or 160 packs of humanitarian aid, of the food certificates. The charitable organization tried it. Provided also humanitarian aid in prisons, for example. TB People organization, they provided the food packages and certificates for food. So essentially what I'm trying to convey is that by being united together and united as one, we can conquer and we can win and we can withstand anything.
На базі шелтера надається комплексна допомога, безкоштовне проживання, харчування, доступ до базових потреб, медико-соціальний супровід, психологічна допомога, юридична допомога, допомога в організації подальших життєвих перспектив, а також логістика у інші регіони України.
Також actually provided quite comprehensive line of help. They give them legal support, psychological support, mental support, psychosocial support, and also logistic support for them to be able to be transported to other parts or other cities of Ukraine.
Також шелтер забезпечен благодаря вновь великой поддержке ЮНЕС с дизельными генераторами, топливом для них, тактическими аптечками, специальными респираторами. То есть в случае перебоя електропостачання і всього остального шелтер буде працювати все одно 24/7.
And also, we would just like to commend and say thank you for a tremendous line of support provided by UNAIDS to us, with like diesel generators, med kits, and so first aid kits. And so in case there's a power grid disruption or something else happens to the shelters will continue carrying on and they will continue working like nothing happened just because of this support.
Шелтер дуже тісно співпрацює з міською адміністрацією, яка допомагає шелтеру постачанню продуктових наборів, хліба, води, овочів та средств гігієни.
So shelter works really tightly with the city council, and so we are helping them with providing food packages, food certificates, hygiene packages, and many other financial support as well, so that they can be operational and host as many people as possible.
Також шелтер тісно співпрацює з воєнною адміністрацією міста. Шелтер цілодобово приймає представників вразливих груп населення з окупованих міст, які привозять як поліція та воєнні. Были случаи, когда привозили военные людей в одних тапочках, даже без обуви, потому что были разрушены их домівки, так как город прифронтовой, и их привезли прямо вечером, где они сразу смогли поселиться, получить все самое необходимое и обеспечить хотя бы то спокойствие среди ночи, которого у них было отнято.
And so also our shelter is tightly cooperating with the military council or the military administration, because there was a lot of things happening like on the occupied or near the occupied territories, because for example we had a case when in the evening the military personnel just brought people to us in their bare food without anything of their possession, because their houses and their buildings, they were just bombed, and so they're out in the streets without anything. And so they brought us in the evening, we gave them food, we gave them clothes and all the necessities for them to at least somewhat relieve their worries about what had just happened with them.
Мешканців шелтеру супроводжують до медичних установ для провадження прийому препаратів антиретровірусної терапії та замістительної підтримуючої терапії, навіть навіть без документів. Великій кількості временно переміщених осіб допомогли знайти роботу, після чого вони змогли орендувати житло в Кривому Розі та почати самостійне життя.
And so the shelters actually helped and supported people or IDPs with getting to medical facilities to get ERT or OST, even if they don't have documents for them to have free access to that. And also a lot of IDPs were helped to get a job. And so after they got a job and they got paid, they were able to actually rent an apartment in Kryvyi Rih and start their life anew.
Невдовзі планується відкриття другого шелтеру за підтримки фінансування Криворізької міської ради, ЮНЕЙДС та Міжнародного благодійного фонду Альянс громадського здоров'я. Він зможе прийняти ще більшу кількість людей.
So soon, recently, we are planning to have an opening of a second shelter in the city with the city council support and public health center support to be able to serve even more people.
Шелтер Україна – це велика родина, надає не тільки прихисток, а насамперед там надають людині змогу відновити особисту гідність та віру в себе та наснажують на самостійне подальше забезпечення свого життя.
So we are trying to help them with everything we have, and so we are trying to keep the dignity and the self-belief of people as high as possible and to set them up for success in their future, safe and sound life.
Віримо в перемогу, все буде Україна.
We believe in our victory and Ukraine will prevail. Thank you.
So I would like to say thank you to all our presenters today. And we need to applaud all of them because they're real heroes, because numbers on their slides, it's 1,000 lives that were saved just because of them. They're a prominent example that cooperation and consolidation of the efforts of UNAIDS, civil society, community-led organizations, and local governments and fast-track initiative can lead us in these great results despite of war conditions. We can do everything together. So guys, it's for you. На цьому ми закінчуємо. Щиро дякуємо усім. На все добре.
Can hear you, Dash.
Okay, I'm wondering if I know we have two people sitting in the room right now. Oh, hey, I'm on the big screens. My mother always told me I had a voice for radio, and then that was it. I wonder if I can pin this. Ooh, all right. I can't hear anything out of the room though, so I'm hoping I can hear them. It's Shauna. I can't hear anything. I can't hear the room yet. Nope. I wonder if we get the sound person. Oh, maybe I hear something.
Good morning.
There we go.
Okay, perfect.
All right. Okay, so if we can, I wonder if we can zoom out just a tiny bit so I can see who's sitting at the table. It's like I'm actually there. I'm just right there. I'm sure my roommate is very happy that I'm moderating and speaking while he's sleeping, but that's fine.
Would it be okay to stand as well, or is it seated better?
If you want to stand, I believe the person operating the camera is able to. It's like a mobile camera. It can turn and move. So I've been in other sessions where people have stood.
Okay, is that okay to sit or stand? Which would you prefer? Okay, well I'll sit too. I don't want to. Yeah.
Okay.
Okay.
So
I noticed.
Shauna, I see you in the room, and I think we have. Is Carly in the room?
Mm-hmm.
Okay, and Andrea Gonzalez Rodriguez.
Yeah, here too.
Okay, Dr. Alexander De Pocamandi.
Yeah, here.
The Pocamandi.
Yes, the Pocamandi. Yeah.
De Pocamandi. And then virtually we have Kelly. There we go. I see her on my side of the screen. So I believe everyone should have their slides that were sent in. So that should be brought. So those will be brought up. And then Kelly, you can either have the tech team put your slides through, but if something happens, you should have them on the side and waiting, and you can hit your screen and move forward with your slides. I have most everyone's short bios, and I'll be reading them between, just as a brief introduction for everyone. Let's see. So the speaking order, it will go Shauna, Carly, Andrea, Alexandra, and then Kelly virtually for the last one. Okay. And on my side, it tells me it's 5:30 a.m., which should be 11:30 a.m. And that means we should go ahead and get started. I want to just check to see if we're virtually streaming right now. Should go ahead and get started. All right, excellent. See if we're virtually streaming. Right? There, yes, we are. All right, so welcome everyone to the City Case Study Session 6 for the Fast Track Cities Conference North America session. My name is Dashiell Sears, and I'm the North American Regional Director for Fast Track Cities. With me today, we have five presenters for our Fast Track Cities North American session. I'll read each one of their bios very quickly before they present, but we're going to start with Shanna Hastie. So Shanna Hastie is a native of Sumter, South Carolina. She has over 20 years experience in public health social work and community level engagement with vulnerable populations. Currently, Ms. Hastie is known as a subject matter expert in her role as the Preventative Health Social Worker for STD, HIV, and Hep C Division for the DHEC Lowcountry. She also served as the director of SHAPE, which is the Sexual Health STI Awareness and Prevention Education Initiatives in Tri-County. Under her leadership, Ms. Hastie led this organization in becoming a 501c3 and establishing the first free at-home HIV testing kit pilot program in South Carolina. Ms. Hastie also contributed to her expertise with various initiatives, such as the COVID response in South Carolina, Healthy Tri-County, Ending the Epidemics in South Carolina HIV Planning Committee, and Fast Track Cities Charleston. She is an active advisory board member of the Prison Grant Advisory Board to address the needs of HIV plus newly released individuals within the South Carolina Department of Corrections. In 2022, Ms. Hastie was nominated for Public Health Social Worker of the Year. Ms. Hastie continues to use her compassion dedication to service to increase health equity among diverse populations at the community level. Ms. Hastie, you have the floor, and thank you for coming.
Well, thank you so much, and good morning to everyone in the room, everyone live streaming. It is definitely an honor to be here. I want to just really talk about some of the work that we have been doing in Charleston, South Carolina, around one of the Fast Track cities, but our project, our focus was The Future Is You. And so before we get started, let's look at numbers. This is a number groups, I can tell by looking in the audience. So we're looking at what are our numbers in Charleston, South Carolina under the 95 targets. People living with HIV have been diagnosed 85%, and people living with HIV virally suppressed 88%. But our focus of what we really want to work on is those individuals who are actively on antiretroviral care, and that's 67%. And we had to understand that although these numbers make a big difference in the work that we do, we really wanted to work together collectively to see how we can improve those numbers of those who may be out of care currently. Now, this is a map of South Carolina, and I'll say this, it's almost like looking at a pie. If you look at the bottom of this pie, at the peak, this is the low country, and that's the conversation that we're going to speak of today. That's what we're going to focus on. There are approximately 10 counties in the low country, but our focus has been more so in the Tri-County area. And those three areas that we're going to focus on is Berkeley, Charleston, and Dorchester counties. Now, the color codes for this map is really highlighting the number of individuals that are living with HIV in our areas. In the Berkeley County, we have those who are out of care that we are looking at these numbers as well. So the out of care in Berkeley is 134. Dorchester is 119, and Charleston, one of our larger counties, is 566 individuals who are currently out of care. And when we think about individuals who are out of care, we don't really have that number on what causes that, right? We have a lot of individuals in our areas that may be transient, that may be out of care because they don't have transportation. So we look at some of those factors that could be taking part in why individuals are not currently in care as well. The key point of this conversation is that this is not monolithic. We need each one of our groups and our partners to make the difference and bring it about the future is you. So collaboration is key for any intervention. And when we look at our focus, these are some of our partners to highlight: the Ryan White Wellness Center, which provides care for individuals who are living with HIV, as well as providing PrEP and education. Shape Tri-County is a collective nonprofit organization of partners who are focusing on empowering communities to make healthier choices related to their sexual health. DHEC and MUSC Health. And I also want to highlight that individuals, a part of our partnership, also really focus on not just having individuals in care, but also ensuring that there are PrEP opportunities for those individuals as well. I'll say highlight at the bottom, MUC Health have providers who are also providing PrEP for a telehealth program as well. Now, when we think about collaboration, we really started to highlight the U equals U, undetectable meaning untransmutable. And some of our previous conversations at this conference has been, what really is U equals U, and how can we talk about the language? The work that we've done, if you look at the picture on the top left, we wanted to utilize some of the resources that we had in our areas. In the Charleston area and Columbia, which is one of our other neighboring cities, we went out and searched for artists to create a U equals U sign. Now, it looks very big and huge, but it's one of those things that we're able to kind of fold and use at various events throughout our counties, throughout various events. On the top right, you can see we utilized the U equals U sign at our World AIDS Day event. And we were happy to sign on to U equals U in March 2nd, 2021. I'm a part of that campaign because we wanted to highlight the fact that evidence-based research supports U equals U. That means living with HIV plus effective treatment leads to being undetectable. And that's the part of, at the bottom, that's the National HIV Testing Day. Pictured below with the city of Charleston, along with our mayor, Mayor Tecklenburg, held a press conference on June 25th, 2021 at our city hall. Now, when we started to bring about U equals U, we really want to bring more of that momentum. Like, how can we do more in our communities to highlight what the work that we have been doing? And that really helped birth the Future is You, the concept of how we wanted to utilize resources in our areas to highlight the needs that we had. So we looked at 4 different concepts when we thought about building the campaign for the Future is You. The first is we wanted to remind people that HIV is still a serious health issue in our community. We wanted to reduce the stigma around HIV by normalizing the conversation. We wanted this to be a conversation that you can have with your friends and family around coffee, or just being able to have that conversation when you're talking about other health issues, maybe diabetes or other health issues like hypertension, having this to be a part of that conversation. And we wanted to educate people about being undetectable and untransmutable. Last but not least, our main goal is to empower people to take charge of their health and empower them to get tested and treated. So some of the strategies that we use with the Future is You, our campaign, is first we were able to receive funding that focused on PSA's grant award to provide resources, and PSA's focused on STIs and HIV and PrEP or co-infections at the regional level. As I mentioned before, South Carolina is a component of 4 different regions, and the Low Country, Midlands, Upstate, and PD areas all receive this funding to promote their strategies for creating a PSA. So in 2020, we received $2,000 to really start our PSA. One of the points of actually having this, I'll say, making sure that the Future Is You was live and well, we needed to make sure that the individuals providing the funding were able to receive the post data regarding the interventions that we've utilized. Ryan White Wellness, one of our partners, not only utilized their marketing team, but also added to some funding so that we could create the Future Is You website. And a lot of us shared the website on our web pages with our listserv, and we'll highlight that website shortly. The next phase of the project was in 2021, where we received additional $3,000 of the PSA grant award, and we wanted to expand on the Future Is You with a digital billboard that we could utilize in our major highways in the Charleston area. We initiated this PSA campaign we had to initiate this campaign by December 31st, 2021. And now in our current year, we are pending this $3,000 additional PSA grant dollars so that we can focus more on the Future Is You by adding on a social media platform as well as Instagram. And so that's something that we felt like we haven't utilized as much, so bringing more light into using some of our social media platforms. Our target audience for our campaign was, we wanted to focus on individuals that were 18 plus, that lived, worked, and played in the Tri-County area of Berkeley, Dorchester, and Charleston. And while we do recognize that the LGBTQIA communities are some of our key audiences, we wanted to reach across the board and make this a very inclusive, I'll say, project so that individuals could understand that this would benefit everyone as a whole. The Future Is You was a collaborative effort developed by community partners to address the stigma of STI, HIV, and to promote STI, HIV awareness and prevention. And so this is the website that we really shared with the community. And I may need a technical person to assist with this. I'm not sure. Are we able to click on that link for the futureisyou.org? Okay. So maybe
I don't know if it's possible.
I'm sorry?
I don't know if that might be possible.
And that's okay. That's okay. We can work without that. So we go back to the website. I just wanted to be clear. So the first thing we looked at, this is the Future Is You. And when individuals were able to click on the link, not only were they able to view what we highlighted, we want to make it fun. We want to say, hey, this is not the 80s anymore. Some of the next slides, you're going to see some of the fashion from the 80s that some things are just a hit or miss now. So these are some of the billboards that we use in the Future Is You. Individuals who were able to click on that link were able to also utilize a link that provided where they can locate local services in their area. So if they needed PrEP, STI testing, or even if they needed to get back into care for antiretroviral treatment, those options were actually available on the Future Is You website. So this, when we look at Let's Leave HIV in the Past, individuals going many of our major highways were able to see some of this, like I say, fashion-forward thinking in many ways. And I'll say next slide for myself. So here are the 4 different, when you're driving down a busy highway, you will see some of the highlights. Like I said, some of these fashions are hit or miss. Some of you in the audience or live streaming may still have some of these in your closet, and that's okay. But we wanted to say, well, HIV is not like the 80s, right? It's not a death sentence anymore, so it's definitely something that we can look at and say, individuals are able to receive treatment and also live long and healthy lives. The digital billboard helped to expand our messaging, and we utilize our marketing in our local areas to help bring that to fruition. And like I said before, we use the Beltline and major highways in Charleston, South Carolina. We chose the dates of December 6th to 2021 to February 27th to 2022 because this is a time frame where there's a lot of heavy traffic in our area, a lot of holidays. So we wanted to make sure we had a vast audience to be able to utilize these signs or see the future is you. Based on the marketing, there were over 2.5 million impressions of individuals 18 plus who actually had the opportunity to view the actual billboards in our areas. So last but not least, we like I said, we were utilizing the funds. We're focusing more on our social media platform, but the conversations that really came out of the Future Is You are really what are our next steps. And one of the things that we are focused on now is really hearing from the community. So most recently, within the last week or so, we had our first Fast Track Cities community chats, which was held at one of our local universities with college students, and they are definitely advocates for the cause, and they were able to share their insights on what is possible. And none of this could be possible without the help of I'll say the city of Charleston. Our mayor is very active in this, and we wanted to have these chats. We're still planning additional chats where we can have it at locations that people really are comfortable with, even faith-based institutions as well as community, I'll say buildings that people feel safe and secure. We definitely want to make sure we increase some of the work that we're doing around the rural areas that may have difficulty getting access to care. We wanted to make sure that as we are tapping into the social media platforms that we don't leave out those other aspects such as dating apps to really highlight the Future Is You and ensure that, yes, the digital billboard was a fantastic idea, but we want to make sure there are other avenues for individuals to see the Future Is You, the U equals You, and all of our different events that we may have focused on creating those steps to be a zero with HIV. And also next step is really just applying and looking for additional funding for the work that we've already completed. So thank you so much for the conversation. This is my contact information as well as our regional medical director, Dr. Catherine Richardson, who would be happy to answer any additional questions that you may have in regards to the Future Is You. So thank you so much.
Thank you, Ms. Shauna Hassey, for your delightful presentation. We're going to move on to the city of Denver now with Carly Salon. Carly Salon is a licensed clinical social worker and licensed addiction counselor with over 7 years of experience in community mental health and program development. Carly spent several years creating and managing alternative response models and programs throughout the criminal justice system. Carly developed and staffed the STAR van during its initial pilot year and recently transitioned to a position with Denver 911 Communications as the STAR operations manager to oversee the expansion of the program. Carly, you have the floor.
Thank you, Dash, and thank you everyone for coming today to hear about some of the progressive work we're doing in Denver. So STAR stands for Support Team Assisted Response, and what we've really been focused on in Denver is creating new pathways for response through Denver 911. We've traditionally had 3 response pathways. When you call 911 or non-emergency, you get a police car, a fire truck, or an ambulance, and that's been it for decades and decades. And what we've been working on for the past several years is sending the right response, creating response options that meet the needs of our community in a different way. So in 2016, we started a co-responder model. So we placed clinical social workers and licensed professional counselors in cars with Denver police officers to respond to behavioral health calls. That program's still running today. It's expanded several times, but what we've realized since starting that program is that folks call 911 or non-emergency for a variety of different reasons. We were sending our co-responder teams, those clinicians and police officers, 2 calls that really were more related to public health issues, poverty, homelessness, things that we really didn't need an officer for at all. We needed a clinician. The social worker was able to handle those calls, but for lack of a better term, the police officer was essentially just our Uber there, and that didn't seem like a good use of their time or a good use of the co-responder team's time, because they're really supposed to be more dedicated to higher acuity calls where there's a scene safety component and we wouldn't be safe sending a clinician on their own. Calls with a weapon, barricade situations, things like that, where we want that clinical support for that individual in our community who's in crisis, but we couldn't necessarily send the clinician alone. So kind of STAR was born out of the co-responder program, and we decided that we were going to pair a behavioral health clinician and a paramedic or EMT and send them to these low risk, low acuity calls that were coming into our 911 system. So we're based off the Cahoots model from Eugene, Oregon. They've been running a program like this successfully for decades and decades. In May of 2019, a delegation from Denver, including myself, went out to Eugene to visit Cahoots. We were able to do ride-alongs. They put together a fabulous program for us over 3 days, and this work really made sense to us. It was largely the work that we were already doing through our co-responder program, and we really just had to make some tweaks to sort of fit the program to a larger metro area like Denver, but we really wanted to add this response option to meet the needs of our community, marginalized communities, vulnerable populations in Denver. Send them a supportive, trauma-informed approach versus a one-size-fits-all approach that we've been sending for decades and decades through 911. So STAR really focuses on low-risk, low-acuity calls coming in. Presence of a weapon would negate STAR response. Anything where a crime has been committed, there's a victim or a suspect, something like that. We're really focusing on those lower level calls. General assistance calls from the community. As a clinician who's worked in the field for a number of years, until I sort of got involved in this criminal justice work, I really had no idea the breadth of different situations that folks will call 911 for. Someone who takes the bus from Philadelphia to Denver and runs out of money, doesn't know where to go next. Folks who don't have food access that evening. Folks who are struggling with their children, refusing to go to school. And historically, we've been sending a police officer to deal with all of these issues in our community, when really what these folks need are support, connection to ongoing services, and that really helps them helps them to prevent that cycling in and out of crisis that happens over and over and often leads to frequent interaction with the criminal justice system. So some data, 70% of our calls, and I'll dive in a little bit more into the data later, are STAR is the first and only responder on those calls. We are sending STAR directly dispatched over the police channel through 911 to these calls. The clinician and the medic arrive, and they're able to handle the call. No first responders are contacting that individual whatsoever. And 30% of our calls are actually Denver police officers showing up on scene first, because it sounds like a call that needs a police officer. They recognize that this situation isn't exactly what it seemed in the call notes. I'm really not needed. I'm going to request STAR to come and take over that call. STAR arrives, police officer leaves, and we're able to support that individual appropriately and get them connected to the appropriate services and supports that they need. The medic is also an incredibly important part of the team. A lot of the folks that we are contacting are in crisis. They may have behavioral health issues, they may have a co-occurring substance misuse disorder, but they oftentimes have chronic health issues that are not well managed. They deal with difficulties with transportation, difficulties with healthcare access, especially our populations of folks who are unhoused or people who use drugs in Denver. They don't have a great relationship with the healthcare providers that work in the ER. They feel that they're not taken seriously, they feel like they're not supported correctly, so they just don't access care. So our medic and EMTs are able to do a lot of assessment and triage, really show these folks a different side of healthcare, one that is person-centered, one that takes a harm reduction approach, and is able to really meet the needs of that individual in a way where they feel comfortable and they feel empowered to access healthcare and prioritize their own health. Our medics and EMTs do a lot of wound care, a lot of consulting and assessment and triage, and we also try to connect folks to the appropriate level of care. So maybe connecting people to a healthcare clinic or an urgent care versus always transporting folks with these chronic health issues that are not well managed to the ER by ambulance, which is very expensive, and they're just stabilized and released, and we're really not attacking the root cause of the issue, which is lack of access or difficulty with access. So who receives a STAR response in Denver? So STAR currently serves the entire city and county. Folks call into 911 or non-emergency. Their calls are triaged in the same way that all 911 calls are triaged. We didn't have to change that process at all. 911 call takers and operators are already asking the questions that are necessary to triage an appropriate STAR response. They're asking questions around scene safety. They're asking questions around call priority. How quickly do we need to get folks there to help? Do they need lights and sirens, or is this a non-emergent issue? They're asking questions about weapons. Is there a crime that's been committed? Is there a suspect description? Is there a victim description? These are all the same questions that we need to determine if STAR is appropriate. Essentially, if there is no weapon, it's a non-emergent call. Folks are safe and stable enough to wait for a non-emergent response to get there. There's no crime victim. Then we can start thinking, is STAR the appropriate response? Is this something that requires our traditional first responders, or is this member of our community really more in need of assistance, support, connection to ongoing supports and resources? And what I've heard from the call takers and operators at 911 Communications is that this new option, this fourth responder that we've created, really made sense to them, especially the folks that have been doing it for a really long time and recognize that they get this category of calls where they really don't feel like they have the right response to send, right? And they have to send a police officer because that's who goes to everything. You know, the officers will go, and really also recognizing that they are not the appropriate response, but they have to send someone. Another important note to make is that folks oftentimes assume that we have maybe a difficult relationship with the Denver Police Department, or that we might be sort of adversarial, or that Denver Police might have been resistant to this type of program being created. And I like to just sort of squash that, because Denver Police have been a huge supporter of our program. They really understand that they don't belong on these calls. They oftentimes feel like they're showing up and they're ill-equipped to assist the person. And this really isn't police work. This is case management. This is healthcare. This is harm reduction. And while our officers will do their best to help, you feel like you're showing up with one hand tied behind your back, and you really just don't have the right set of skills to address the need that this person is bringing to you. So they've been a great supporter. They request us often. Denver Police does not house the program. Our contract is housed within the Denver Department of Public Health and Environment. The program is operationally run out of Denver 911 Communications, and then we contract with a local behavioral health provider and our local paramedic division to provide the staff who ride on the van and respond to calls. So we rolled out our pilot June 1st of 2020. That was our first shift ever. We were supposed to roll out March 1st of 2020, and a little thing called COVID happened, and we had no PPE and all the things, and kind of comical to think back on at this point, but we said, well, we'll wait a few weeks and this whole thing's gonna blow over and we'll roll out mid-March. Well, that didn't happen. We rolled out June 1st of 2020, and our community really needed this more than ever. Folks were isolated and dealing with low-level depression and anxiety because of the pandemic and the lockdown and all of these things. And our unhoused community and folks who, were living in poverty were really disproportionately impacted by the COVID lockdown and the shift to telehealth because of the lack of access to internet, technology. Providers that they used to be able to walk into clinics and connect with on a daily basis were no longer there in person. So we really kind of filled that need. We had our tablets, we facilitated telehealth appointments for folks. We were responding to all kinds of crises. And for that pilot period, we operated in our downtown police district 6, which also happens to be the location where most of our social services are located. So we knew it would be a high need area. We ran that pilot for about a year and a half, one van, working Monday through Friday, 10 to 6. We gathered a lot of really useful data. We were able to secure funding from the City General Fund and from a foundation called the Caring for Denver Foundation, and we're able to expand our services last year. So we are currently working our way up to 5 vans. We have 4 now. Our last few staff are getting onboarded, and we run 7 days a week from 6 a.m. to 10 p.m. And I'll explain the reasoning behind that time frame in a later slide. And it's going very well. The expanded bandwidth has been incredible. We're now able to serve every corner of the city and county of Denver, and we're adding 2 additional units and peer positions in 2023, which we're very excited about. So this is kind of a response map. Since the expansion, larger circles indicate a higher rate of STAR response. But you can see that we're reaching every community in Denver. There isn't an area of Denver that we are not serving. And it's also interesting because if you look at sort of public health data, we have what we call public health hotspots that we've addressed as being neighborhoods with high rates of overdose deaths and other factors that contribute to early death. And if you overlay that with our heat maps of STAR, they're almost the same, which isn't a surprise at all to many of us in the room, but we've really recognized that these communities, our downtown community, our far northeast Denver community of Montbello, South Federal, these are areas that have difficulty accessing healthcare, physical healthcare and behavioral healthcare. They struggle with poverty, they struggle with crises, and it feels really good to be able to create a program that can specifically serve these communities in a new way and in a way that feels supportive and comfortable to them. I also forgot to mention that through our expansion, we are also funding community providers to specifically create support services for STAR. So STAR is really a 2-pronged approach. There's the folks that show up on the van, mitigate the crisis that people are dealing with, and then really the second prong is to connect those folks to services that feel culturally appropriate, that are geographically convenient, that are identified by the people we're responding to. So we're not showing up and saying, hey, call this number. We wouldn't be able to assist folks in making a direct connection to community services and supports that they've identified would be helpful and supportive. So that all sounds great in theory, but we need to provide funding to these organizations in order to be able to serve the population who's receiving a STAR response. So that's also going to be a big part of our expansion, is funding those back-end services that we rely on to help folks stay out of crisis and away from the criminal justice system. So in conclusion, this is just some data. Since June 1st of 2020, we've run just about 6,500 calls for service that would have otherwise been dispatched to a police officer. Our top 3 most frequent calls are welfare check, trespass, unwanted party. So someone is sitting on someone's front lawn and it's private property, or sleeping in a business doorway. We can send the STAR team to talk to them, to provide them snack and water, talk to them about supports and services that they would feel would be helpful, whether that be syringe exchange or a day shelter or a formal behavioral health referral. And then the third is that general assistance call. So the kind of wide category of calls where folks are just calling in because they need some sort of assistance and they just don't know where else to turn in that time of need. And the really colorful chart there is our call volume for STAR identified calls by day of week and hour of the day. So we've tracked STAR appropriate calls 24/7, 365 citywide. And you can see that the bright red and orange squares indicate our highest need times, and that tends to be Monday through Friday business hours. Folks are sometimes surprised by that data point and think it might be more nights and weekends, but this mimics our overall call volume in Denver. We have a lot of folks that commute into the city for work. Our population grows, our call volume goes up. This is also when folks are calling and saying, hey, I'm trying to open my business and there's someone sleeping in my alley or someone sleeping in my doorway, or I notice someone who's having a big behavior outside Starbucks and I'd like someone to go check on them. So that's where we're putting our initial set of expansion resources, and then once we meet the full need of that time frame, which I think 2 additional units in 2023 will get us pretty close, we can start looking at expanding to overnight and a full 24/7 model. That was it. Thank you, everyone. I appreciate it.
Thank you, Carly. We're going to move over to Mexico City with Dr. Andrea Gonzalez Rodriguez, who is the Executive Director of Condesa. Dr. Andrea, floor is yours.
Gracias. Buen día. My English is very bad, entonces voy a hablar en español. La presentación está en inglés. Y bueno, presento la experiencia de la Ciudad de México, especialmente de las clínicas especializadas Condesa. Son 2 clínicas que se encuentran en 2 regiones de la Ciudad de México, en la alcaldía Cuauhtémoc y Iztapalapa. Pertenecen al gobierno de la Ciudad de México y son clínicas con un modelo comunitario que atienden poblaciones clave de alta prevalencia, sobre todo hombres que tienen sexo con hombres y mujeres transgénero, y también tiene programas para poblaciones de baja prevalencia, pero que la marginalidad, el estigma, la discriminación hace que se dificulte el acceso a servicios de salud. Estos son los programas. Hay programas para trabajadores sexuales hombres, para personas trans, para migrantes, repatriados, que es una población especialmente vulnerable, etcétera. Esta es la cascada de la Ciudad de México, en donde, bueno, efectivamente estamos buscando incorporar a tratamiento y tener en supresión viral a la mayor parte de la población, pero también atender a la población negativa, clave, sobre todo hombres que tienen sexo con hombres y mujeres trans, con intervenciones de prevención como PrEP, y como profilaxis post-exposición también, tratamiento de ITS y un tema de periodicidad en el diagnóstico de VIH. Esta es más o menos la productividad de 2021, en donde pues en tratamiento tenía la Ciudad de México 23,035 personas, la mayoría en las clínicas Condesa, 97% con menos de 1,000 copias, 30,344 personas de poblaciones clave acudieron a hacerse el diagnóstico y tuvimos 3,827 diagnósticos en las clínicas. En PrEP, en un programa que inició en julio de 2021, 4,137 personas, y durante 2021, 1,386 personas recibieron profilaxis post-exposición. Entre 2011 y 2021, las clínicas Condesa realizaron 41,651 diagnósticos de VIH. Este es el modelo de diagnóstico, que es un modelo que nos puede dar un diagnóstico integral en 24 horas. El mecanismo es utilizando point of care, pruebas rápidas, pero también utilizando pruebas de periodo de ventana diferente para encontrar infecciones agudas. Fundamentalmente diversas pruebas de 4ª generación. Y este algoritmo nos ha permitido también incrementar el diagnóstico de infecciones agudas y confirmarlas de una manera diferente. Este es, digamos, la evolución del programa de diagnóstico, y aquí puedo mostrarles de inicio el impacto de la pandemia de COVID en 2020, que redujo sobre todo el número de personas que fueron a hacerse la prueba. De este número, pues nosotros tuvimos una reducción del 33%, sin embargo, a nivel de país, México redujo 70% el diagnóstico. Se concentró el diagnóstico y la gran mayoría fueron en hombres que tienen sexo con hombres. Las poblaciones más afectadas por la reconversión hospitalaria del COVID fueron mujeres y adolescentes. Abajo, en la línea de abajo, lo que ven es diagnósticos no de personas que llegan buscando diagnóstico, sino de programas que tenemos de diagnóstico permanente. Este incremento entre 2020 y 2021 es PrEP, son las personas de PrEP, por eso se incrementa tanto. Y también aquí hay un número importante de pruebas en cárceles. Este es el número de diagnósticos y también aquí podemos ver el impacto de la pandemia. Teníamos una curva que se empezaba a aplanar en los últimos años, se redujo en 2020 y luego se incrementa nuevamente y perdimos de alguna manera la medición de la aparición de nuevos diagnósticos. El diagnóstico tardío, que es alto, se incrementó, no lo pudimos medir en 2019 y 2020, claramente se incrementó, pero pues en 2018 era 38% y 39.9% en 2021. Las edades, esta la muestro simplemente por las proporciones, claramente el mayor número de diagnósticos lo tenemos en hombres jóvenes. Claramente la incidencia está en hombres jóvenes, sobre todo de, digamos, 30 hacia abajo. En mujeres es al revés, la mayor parte del diagnóstico ocurre en personas de mayor edad. Este es un proyecto de epidemiología molecular que secuenció 3.168 muestras de personas positivas entre 2019 y 2020. Encontramos varios clústeres o asociaciones de infecciones y los 10 clústeres más dinámicos son en personas jóvenes, hombres que tienen sexo con hombres jóvenes, recientemente infectados, con cargas virales altas y CD4 también altas, que de alguna manera nos da una muestra de lo que decía la diapositiva anterior. Estas son las cascadas de 2019, 2020 y 2021. Y bueno, yo estoy mostrando una cascada que todavía no funciona en el caso de la Ciudad de México, pero un problema que tenemos es que del número de personas que diagnosticamos, una proporción importante no le corresponde atenderse en las clínicas Condesa. El sistema de salud está fragmentado, como ocurre en muchos sistemas de América Latina, quizá en todos, excepto en Brasil. Entonces, aquí lo que nos pasa es que un número muy importante en 2021, 1.234 personas diagnosticadas, no debían atenderse en la clínica y la mayoría debían referirse a instituciones de seguridad social. Este dato, cambiamos la metodología y se capturó a partir de 2020, de finales de 2020, y por eso tenemos y sabemos este número. Todavía en el grupo de pérdidas, que si ven son 437 personas, el 12.9%, que son personas que ni ingresaron a las clínicas Condesa, ni tampoco tenemos registro de que se hayan ido a la seguridad social o de que tuvieran derecho a ellas, pero todavía ahí podría haber más personas con seguridad social. En México, las personas con trabajo, con empleo formal o dentro del sistema educativo tienen seguridad social y las personas que no están en el sistema educativo o su empleo no es formal o están desempleadas no tienen seguridad social. La mayor parte de las personas están sin seguridad social y como nuestra población es joven, frecuentemente adquiere y pierde la seguridad social y pasa de una institución a otra. Haciendo cálculos con los datos disponibles de las instituciones de seguridad social más importantes, aproximadamente 36.5% del total de personas que se atienden por VIH en las clínicas Condesa cambian en algún momento, no permanecen durante el año en las clínicas Condesa. Se pierde esa continuidad y esa medición. Entonces, y las instituciones de seguridad social no ofrecen sus datos y tampoco miden los indicadores de la cascada de atención. Esto hace que a la hora de medir, en rojo ven ustedes el número de personas atendidas en las clínicas Condesa, y aquí pues perdemos, como les decía, a cerca del 30% que no permanecen. En morado pueden ver a las otras 2 instituciones que atienden personas sin seguridad social en la Ciudad de México. Y entonces pues tenemos un control de la epidemia entre este grupo importante, pero el problema es ese 36% que no permanece en las clínicas Condesa. La cascada de personas trans en la Ciudad de México, en las clínicas Condesa tenemos un programa de terapia hormonal gratuita que nos permite tener gran retención. Sin embargo, en 2020 tuvimos una reducción muy importante de la adherencia y al tratamiento antirretroviral, pero les puedo decir que también se perdió la adherencia al tratamiento hormonal, porque el tratamiento hormonal funciona como un servicio que incentiva que se mantengan en el tratamiento de VIH y ha sido muy exitoso. Siempre habíamos tenido por arriba de 90 la supresión viral en trans. Este es también impacto de la pandemia de COVID. Esta es la proporción solo de personas trans. Tenemos 2.752 en la clínica Condesa primera, que es la de Cuauhtémoc, 751 en Condesa Iztapalapa, y tenemos una nueva clínica que es solo trans, que acaba de abrir y que tiene 120. La mayor proporción en la clínica Condesa Cuauhtémoc es de mujeres trans. Estas son las prevalencias de agosto de 2022, que pueden ver del total de hombres que acudieron a la clínica, el 12.2 salió positivo a VIH, 0.98 hepatitis B, 2.07 hepatitis C. En mujeres esta es la prevalencia, pero en las coinfecciones sí quiero señalar un tema que también creo que en América Latina y en América del Norte está muy presente, que es el incremento de la prevalencia en sífilis. 24.4% de las personas que acudieron o que se hicieron pruebas entre positivas y negativas a VIH tuvieron sífilis activa. Estas son las prevalencias por población. Las poblaciones en donde tenemos trabajadores sexuales hombres es la prevalencia más alta. Después mujeres trans, hombres que tienen sexo con hombres, y las otras son prevalencias más bajas de poblaciones que atendemos desde las clínicas. Esto es en azul los nuevos diagnósticos que, como ven, se reducen en 2020, pero vean cómo los inicios de tratamiento se incrementaron en 2020, o sea, la cobertura de atención tuvo que ser mayor, y los pacientes que perdieron la seguridad social o no pudieron entrar a sus hospitales en las instituciones de seguridad social por la reconversión hospitalaria se incrementaron. Esto hizo que 2020 fuera el año histórico de mayor número de ingreso de personas a atención en las clínicas Condesa. Esta es una cosa que hicimos en 2019, no le hagan mucho caso al círculo, pero en realidad teníamos terapias antirretrovirales basadas en efavirenz hasta 2019 y en segundo lugar en atazanavir y caletra inhibidores de integrasa de primera generación. Se hizo a nivel nacional un diseño, este es el diseño, para cambiar las terapias y las modificamos totalmente utilizando inhibidores de segunda generación como primera opción. Y aquí tienen los inicios de tratamiento que sí pueden ver 2021-2020, prácticamente inician en Biktarvy todas las personas. Y estas son las terapias vigentes. La mayor parte de las personas está con inhibidor de integrasa de segunda generación, con Biktarvy. En segundo lugar, personas que se quedaron en la tripla, indetectables, y cerca del 90% de la población con una sola pastilla, que fue un cambio que en Norteamérica no es fundamental, pero en México fue un gran cambio para facilitar las terapias antirretrovirales. Este es el incremento de la atención. Como ven, las personas en atención son mucho más que las que puedo medir dentro del continuo de cascada como supresión viral, y se debe a este 36.5 que no permanece en la institución y que se va a una institución de seguridad social. La intervención de PrEP, que empezó en julio de 2021, que actualmente tiene en la Ciudad de México 3.078 personas en PrEP y 1.059 monitoreadas desde la Ciudad de México en ciudades de otros estados de la República, Jalisco y Oaxaca, que acaba de ingresar. Este es, en este año hemos tenido 4.137 usuarios de PrEP, 23 fueron infecciones agudas cuando llegaron solicitando el PrEP y 1 con reconversión con una incidencia de 0.5 en este grupo de personas. Y las coinfecciones, la más importante fue sífilis con 15.6, pero si pueden ver es 10 puntos por debajo de la prevalencia general de sífilis. Hepatitis C creo que también es importante, pero también todas las coinfecciones están por debajo de las prevalencias generales del resto de las poblaciones. 2.520 personas acudieron buscando profilaxis posexposición, 1.386 fueron candidatos a profilaxis posexposición. Con datos oficiales estas son, digamos, cómo se movió la mortalidad. Claramente se incrementó en 2020, la causa fue fundamentalmente la reconversión hospitalaria y la falta de acceso a hospitales de tercer nivel altamente especializados, y aún creo que está muy subregistrada ese incremento de mortalidad. Y pues el 11 de junio tuvimos el primer caso de monkeypox. Al día de ayer hemos confirmado más de 600 diagnósticos. Este cierre está hecho hasta el 28 de septiembre. Hemos tenido un incremento muy importante. Estos casos se han diagnosticado en la Clínica Condesa y se han atendido en la Clínica Condesa. Puse la curva de Estados Unidos, que va para abajo con vacunación, la nuestra va para arriba, y es solo para decir que necesitamos vacunas de monkeypox en México y en América Latina. Como conclusión, la fragmentación del sistema de salud en México genera interrupciones en el continuo de atención, perdemos pacientes, descontinuamos tratamientos y retrasa el inicio de tratamiento. El hecho de que los sistemas de información no estén integrados impide que podamos tener una cascada de ciudad como tal. Y a pesar de que incluimos este año una persona PrEP por cada una que entró a tratamiento de VIH, sigue siendo una cobertura muy baja que nos hace pensar que requerimos agilizar esos servicios. Pues básicamente son las conclusiones de lo que pasa en la ciudad. Tener un sistema único, tener integrados los servicios y un esquema universal y estandarizado de atención es lo único que nos puede permitir llegar al 95, 95, 95. Gracias.
Muchísimas gracias. Thank you very much. We're going to be moving on to Montreal now with Dr. Alexander Debocamani, who is Associate Professor and Director of Research at the Family Medicine Department of McGill University and clinician scientist at the Research Institute of McGill University Health Center. She provides primary and specialized care to people living with HIV in Montreal since more than 20 years, practicing at the Chronic Viral Illness Service of the McGill University Health Center since 2009. She is the director of the Quebec HIV Cohort, and her research program focuses on improvement of HIV care and prevention of comorbidities for people living with HIV. Dr. Debocamani, you have the floor.
Thank you. So I'm here to provide the update on Montreal. So I'm the director of the Quebec HIV Cohort since 2020, but this is a cohort that was created more than 10 years ago by the collaboration of the largest clinics in Montreal at that time providing HIV care. We included all people living with HIV receiving care at these clinics and who had at least 2 HIV viral loads since 2000. So it includes a total of 10,000 people, more than 10,000 people over 20 years. And we measured the HIV cascade of care for people in care. So that's the best tool we have right now in Montreal to actually measure the last part of the cascade of care. I would mention that before it was named the Quebec HIV Cohort, before it was called the Cohort Montréalaise, which means Montreal Cohort, and it's really to actually go beyond Montreal that we changed the name recently. So in terms of numbers, in 2020, we actually reached a very good number for people in care. So of all the people who were engaged in care in 2020, 99% of them received an antiretroviral therapy prescription, and 97% or more were virology suppressed. Maybe a little less for women, but overall very good numbers. I'm showing the numbers for trans people here to, to highlight the actual problem with clinical data sometimes. And this is something we know that there's more trans, but these are clinical database, and it's one of the challenge is actually to identify properly gender identity, but I would even say all the social determinants of health. And this is often what's missing from the data we use to calculate the cascade of care. So as a group, we're going to try to improve that part, which is actually should help the clinical care as well. Data from other studies looking at specific group population. So there's the Engage study who's recruiting men who have sex with men, regardless of the HIV status. And when they actually tested for the HIV infection, 100% of them were already aware of their status, and then 97% were on ART and virologically suppressed. Same thing with the study of injection drug users. Of those who tested HIV positive, 97% were aware. Of course, these are prospective cohort, which we expect this to be an overestimation because people engaged in care are more likely to participate in these cohorts. So the numbers look good, but we know that this is representing a part of the population and that this 3 to 5% that's missing, depending on the category, is not randomly distributed. So what we need to look at now is more in depth to actually get at the equity factor. So as a reminder, I mean, health is a fundamental human right. We all know that. And what do we talk about the equity is the absence of unfair, avoidable, and remediable differences among groups of people. We know that discrimination contributes to worsening living conditions. We know that discrimination is often embedded in the institution system. We know that the multiple types of discrimination can intersect with each other in the population we care for. So health equity is really when everyone can attain their full potential for health and well-being. So we now have to go deeper in our data and the results. And what do we need to actually achieve equity? Well, we need knowledge, monitoring, and analysis. So we need to know who the people are that we are missing and how to improve. So we need data that is disaggregated by age and sex. That's generally easier to obtain. But the gender, the education factor, the income, the disability, all these other factors that actually affect the chances of a person to actually reach their full health potential should be looked at and examined as well. Findings should be used to actually design the response for improved equity and for ongoing monitoring of health equities, inequalities. And I mean, the anecdotes that was mentioned in the earlier session today, anecdotes actually matter for this remaining 3 to 5%. So here's I'm showing, this is a type of good way to actually look at the cascade of care that was done by a team in Manitoba, a different province. And they actually built Equiplots by ethnicity, immigration history, injection drug use, or living area to actually highlight factors that can actually flag a more challenge in reaching the cascade of care results. So for example, in Manitoba, the younger age group was identified. And of course, in Manitoba, it's a province where indigenous population are greatly affected by HIV. So one approach to actually use our data to improve both care and do research is the learning health system approach. This approach means that we use existing data to allow continuous and rapid improvement in clinical care. The key points are that it needs stakeholder involvement, and it needs a cycling of, we're looking at our data, we build or co-design improvement in care, and the next cycle of data collection will allow us to verify if we're doing some improvement. So we're going to use the Quebec HIV cohort as a learning health system. We did obtain funding for research funding organism, but also from a pivot grant, which was provided by VIV, but this really is for a clinical project, for clinical improvement. And this is also to show that sometimes we have now to start working kind of in combination of improving our data to improve care in the same times than we actually conduct research. So we're going to update our data every 6 months for continuous first quality improvement of data, so we can actually better use it for improvement of clinical care and research. We're going to examine the results and co-design the solution as team of stakeholders. So we have clinicians working in these clinics, we have community partners, which are really patient receiving care in these sites. But it's also about the knowledge users, community organizations. There's public health representatives are actually should be part of the design. And sometimes it's a local improvement at a clinic that can actually make a big difference. Sometimes we have to go up to a higher level. And then we repeat the investigation to examine the impact of our change. So with this right now, we're hoping to actually improve the last steps of the cascade of care, but also that other step in the health and well-being by looking at comorbidity prevention. Now, the largest challenge I find is actually the before steps. How can we improve or reduce improve equity in the HIV testing and the linkage to care? We know that once they reach care in Montreal and the Quebec province, then it's easier to actually work on that step. But how to reach people not connected to care? Community organizations are key. Some people do not connect also to community organizations, so we have to think outside the box and be creative and actually ask the people who know how we can do better. We need to apply a person-centered approach to testing and care as well, to actually adapt our approach to those for whom it doesn't fit right now, it doesn't respond to the need. And that includes the clinical care, but also the before, like the teaching, of course. Of course, reducing stigma and systemic discrimination. And I mean, working together, listening, innovating, it's like being collaborative and try to do differently when we can is really, I find, the key. So we do have Montréal Sans Sida, who developed it for the fast track cities that Montreal joined in 2017. They developed areas of, we developed areas of strategic intervention, including reducing discrimination and stigma through communication. I mean, communication is key. We do mention it, I think, at every presentation. Eradicate prejudice caused by criminal law enforcement, which is an issue in Canada. Improving living conditions of vulnerable communities, which is coming back to the social determinants of health and how important they are. Implement accessible services adapted to individual needs, the key word being adapted also to individual needs. Patient-centered care is really the guiding principle, I think, for all our approach. The missions and our values of the care provided in the healthcare system needs to be aligned with the patient goals. It needs to be transparent, and the information needs to be delivered quickly and in a understandable way for everyone. Care needs to be collaborative and coordinated. The patient's comfort, physical well-being, and emotional should always be the top priorities, even if we have the viral suppression in mind. And they should be included in the decisions. So in summary, prioritizing equity for HIV prevention and care requires data collection and analysis that considers the social determinants of health and other factors of equity. A continuous monitoring of that data and of the health outcomes that can be selected by the classic cascade of care, but beyond also for patients' agenda and goals. The co-design of solutions should be done as teams of community, clinicians, decision makers, knowledge users. Collaboration, communication is key. The person-centered approaches should be a guiding principle. We should adapt to the healthcare context. So like often the solutions needs to be local because the issues differ from cities to city, even province to province. So like we need to develop and adapt locally with multiple strategies. There's no one size fits all. We need to have like a lot of options for the different people, and a reduction of the stigma and discrimination. I want to thank you, and I just want to show you a bit of the fall color. Mid-October is the best time to see the fall color in Montreal if you want to visit, and thank you for your attention.
Thank you so much for your presentation, Dr. Pocomani. And that was Montreal. We now move on to our final presenter from Pittsburgh, coming at us virtually, Ms. Kelly Prokop with Pittsburgh Prevention Point. Kelly Prokop is the Operations Director for Prevention Point Pittsburgh, which is a nonprofit organization in Pittsburgh, Pennsylvania, dedicated to providing health empowerment services to people who use drugs. She's also a licensed attorney, and prior to joining Prevention Point Pittsburgh in 2021, Kelly worked for the Allegheny County Department of Human Services in various roles focusing on privacy law, competitive procurement of human services, and the intersection of human services and the criminal legal system. Ms. Prokop, you have the floor.
Thanks, Dash. Good morning, everyone. It's still well, I guess it's afternoon there now. It's still morning for me here in Pittsburgh. Really happy to be here and be a part of this conference, but really sad that I can't join you all in person. Are my slides up there? Are folks seeing them separately? I don't need to share them. I can't see them myself, so I'm not positive.
We see it now.
You do? Okay, great. And then do I just ask them to advance the slide? Next slide, please. Oh, I see somebody's doing it for me. Thank you. So I'll give some quick background on Prevention Point Pittsburgh. We are a member organization of the AIDS-Free Pittsburgh Collaborative, and like all of you here to represent our fast track city. Pittsburgh is the only city in Pennsylvania to be designated as a fast track city, and so we're so pleased to be part of this, to be at this conference, and to be working alongside the city, the mayor, and the rest of the AIDS-Free Pittsburgh Collaborative to reach these 95, 95, 95 goals. Next slide, please. So as Dash said in my intro, Prevention Point Pittsburgh is a nonprofit organization. We are a harm reduction focused organization. Our mission says that we provide health empowerment services to people who use drugs. Primarily that is in the form of a syringe service program, but since 2020, we have also had a mobile medical clinic. Primarily it provides buprenorphine prescribing in the form of Suboxone, but also does basic wound care, antibiotic dispensing, pregnancy tests. We refer out to a partner agency for HIV testing and Hep C testing, but then we can help folks connect to treatments who are enrolled in our program. We just don't do that testing on site. Next slide. And I don't know how familiar folks in the audience are with harm reduction, so I just want to quickly talk a little bit about that. And the history of harm reduction as a movement is really rooted in the AIDS crisis in the U.S. in the 80s, and the idea of taking care of each other and community helping itself. So some of the values of harm reduction include meeting people where they are, autonomy, dignity, folks having control and a say in what sort of interventions they receive. Some of the goals, these are, I think we all share these goals: increased health and well-being for individuals and community, safer drug use, and reduced drug use if that is aligned with an individual's goals. And one thing, with the mobile medical services, they increased trust and improved engagement with service providers. So we are reaching a lot of folks, especially through our mobile medical services that aren't otherwise engaging with healthcare for reasons that a lot of these other panelists have spoken about, just the stigma and knowing that if they present at the emergency room, that they often won't be treated as a person. But they do know, after coming to our syringe service program, they know, that we are a safe place. We are people who will treat them with dignity and respect. And so folks are often a lot more willing to come over to our medical van once they've been engaged with the syringe service program. Next slide, please. And so syringe service programs are one harm reduction intervention. It's not just syringes, it's all of the other works for injection, cookers, cottons, ties, alcohol prep pads, et cetera. Also, importantly, syringe service programs provide increased access to naloxone. And I know access has increased through a lot of avenues over the last several years. And we actually are really glad to know that most folks who come to see us already have Narcan. We offer it to every single person who comes, and almost all of them already have it, either because they've already gotten it from us or they have access to it through some other way, and they all know how to use it. We also distribute fentanyl test strips, although at least in Pittsburgh, most folks report that the dope they're testing is fentanyl. It is. So the test strips are not extremely useful. They know going in that that it at least contains fentanyl, if not 100% fentanyl. So we provide access to some of those tools. Test other drugs with fentanyl test strips. Absolutely, we are seeing it in everything. And again, just wanted to share some stats in case folks are not super familiar with syringe service programs. So there have been decades and decades of research about this. They are extremely effective. Rates of HIV and hepatitis C are shown to decrease by about 30%. And I think that's borne out. We don't see a ton of people anymore who report being HIV positive because syringe exchange works. We've been operating in Pittsburgh since 1995 and have made a pretty significant dent in the rates of new HIV infection. And then there's some other stats here, obviously decreased overdose death rates. And people who use drugs, who use syringe service programs, are 5 times more likely to enter treatment programs and 3 times more likely to stop injecting drugs. And with that, the decrease in the related risky behaviors and disease transmission. Next slide, please. But syringe service programs are illegal in Pennsylvania. And that Pennsylvania is the state where Pittsburgh is. Pittsburgh is on the west side of Pennsylvania, and then several hundred miles away, all the way on the east side of the street, or of the state, is Prevention Point, Philadelphia. We are not related. We just have the same naming convention. But we are the only 2 legally operating syringe service programs in the state of Pennsylvania. We operate under local county ordinances that allow these programs in the counties where we operate. And there are some other programs in the state that operate underground, serving folks that are kind of lost in the middle there. But obviously this is a huge goal for us, is legalization of these programs statewide so that we can reach more people. And even within the county where we operate, the way the ordinance works is that it requires a pretty lengthy approval process to open a new site, going through a municipal government approval. So right now, all 5 of our sites per week are within the city of Pittsburgh. And just for some context there, the city of Pittsburgh has a population of a little over 300,000 people, but Allegheny County, where the city sits, is 1 million people. And there's all these small municipalities around us. This is different than how Philadelphia operates. Philadelphia, city and county are one unit, so they are able to, on that side of the state, they're able to serve kind of a broader geographic area than we are over here. And this is the landscape we're operating in when we're kind of in a minority here. 34 out of 50 states either explicitly permit these programs or just don't prohibit them. We're the only state in the Northeast that does not legally permit syringe service programs. There is a bill in the state legislature right now that would legalize syringe service programs statewide, but I think there have been several iterations of this bill through several legislative cycles. And we're always hopeful and always watching that, but not sure that legalization is on the horizon anytime really soon. Next slide, please. So I think we get asked a lot, like, so how, what's the history here? How did you come to operate? So I mentioned 1995. Two folks, James Crow and Carolyn Acker, just kind of saw this need, and the way they put it sometimes is just they know the mechanism of disease transmission, and they know, that syringe service programs are a really obvious point to intercept that. And they saw a need for this, and they just said, nobody else is doing this, let's do it. And they would just set up a card table on the same corner every Sunday morning. That's a really important value that we have, is we are at our sites every day. Like the sites, we operate from 12 to 3 on Thursdays in a specific parking lot, and we are there every single Thursday, regardless of it's Thanksgiving or a different holiday. People know where they can find us, and they can count on that. So they started 1995 to set up their card table. At first, the police were pretty tolerant of it. I think there was an understanding that this service was needed. They weren't really disturbing anybody or hurting anything. But then as the service got more popular, people were, kind of lining up around the block, and then local businesses and neighbors started to complain about this, and, it's disruptive. They don't want drug users in their business district. So a series of community meetings were held, and thanks to a lot of advocacy from the participants in our services, kind of sharing their stories and why syringe service programs matter to them, and from other community members who supported us, the Allegheny County Council passed an ordinance that we still operate under today. And that process was several years. Our first officially sanctioned site opened in 2002. We began distributing Narcan in 2005 and also became a nonprofit that same year. Next slide, please. And so where we are now, I mentioned 5 weekly sites. So 4 of those are mobile van sites with the medical van, and our Sunday site is in a physical building, so folks can come inside and have a little more privacy. And a little more time to have a conversation with somebody. We expect to distribute 1.5 million syringes this year, which, if you can see our other numbers there, we were at 665,000. This is more than double where we were in 2019, and the numbers of people that we're seeing really reflect that. In September 2022, we're literally seeing 3 and 4 times as many people at our sites as we were in September 2019, pre-COVID. And I don't think I have time or necessarily the qualifications to speculate about all of the reasons why, but it's not just that we are more visible, it's that, more people are injecting drugs, more people need these services. And then we've expanded a little bit. We also distribute safer smoking and snorting supplies. A lot of that's harm reduction. It reduces disease transmission, but it's also outreach. It's, a lot of folks come just for smoking or snorting supplies, and then we're able to engage them in conversations, find out what other kinds of services they might need, and help connect them to some of those ancillary services. With our medical program in particular, we just started that, like I said, 2 years ago. Now we see about 100 patients a week for buprenorphine, and that's induction and ongoing maintenance. So folks will come once a week at first, and then, you know, taper off to 2 and 3 times a week to come see the doctor for their refills. We also now have a statewide naloxone mailing program. So that's a partnership with Next Distro out of Boston. We are the Pennsylvania partner, so we mail all across the state. We mail about 1,100 doses of naloxone per month. So that is one avenue where we are reaching folks that don't live in one of these 2 counties with at least Narcan. And then next slide, please. So these are some of our advocacy goals where we would like to see things. So obviously the statewide legalization. There are 1.5 million people outside of these 2 counties. So we are, you know, Philadelphia is a big city, Pittsburgh is 1 million people, but there's a lot of people. It's a big state. There's a lot of folks who just do not have that access. People do come from the surrounding counties to visit our site, you know, driving an hour plus to come get supplies from us, but we would really love to see syringe service programs operating closer to them, whether it's we expand or other folks are able to open up their own programs. And we are currently working on opening our first site outside of the city of Pittsburgh. So that's going through a municipal approval process with the city south of here. But it's slow going, you know, and it's political. It's the, you know, the city council supportive, but don't, like, they're up for re-election, and what are people going to think of this? And if, you know, we wouldn't have to go through all of this if it were simply legal statewide. Other things we would like to see is the removal of syringes and other injection works and smoking supplies from the drug paraphernalia law. We have a pretty good relationship with the Pittsburgh police. We give folks a card. We're anonymous, but people have a code. We give you a little card that says you're a participant in our program. If you're stopped by the police with sterile supplies that you receive from us, generally they will let you go, let you keep your supplies, but not always. You know, it depends on the officer, it depends on the jurisdiction. With all of these municipalities, people are moving in and out of different municipal police department areas. And then of course, the dream is safe injection sites and safe supply. It's, you know, it's full, legal, safe supply. And, you know, we're starting to see that in some other states. New York City has this safe injection site. Rhode Island just committed to doing this. And Vancouver is, you know, light years ahead of us actually doing safe supply. And that's, you know, where we hope we're going. Next slide. And then this is my last slide. This is just a little graphic of Pennsylvania just showing, you know, the scale's not really here, but it's a big state. Just trust me, this is like several hundred miles across. Here, Pittsburgh, here's Philadelphia, and then 1.5 million people just like in the whole rest of the state, where driving to either one of these locations is hours. You know, this is hours of driving. And the only legal program that they really have access to is the Narcan that we can mail, but not the syringes or any other safe supplies. That's all I've got. Thank you so much.
Thank you, Ms. Brokaw. And I'm going to follow with closing this session. This is the session 6 North America. Thank you to all the presenters that presented today. And especially, I am a native Pennsylvanian myself, so I understand the issues and the needs that they're so great in the state. But for all of the presenters here, we've learned a lot. We've shared a lot of best practices, a lot of hopes for where we'd like to go to end HIV and other TB and viral hepatitis in our areas. We're running up against a lot of political determinants of health in relation to what our goals are. And it means removing stigma and having a lot of education to educate so many different stakeholders in order to reach our goals. But we look like we're on our way, and Fast Track Cities is here to help wherever we can and however we can. But for today, thank you so much to all our presenters and our speakers. You did wonderful. I'll follow up with everyone afterwards, but please enjoy your time in Sevilla. And Kelly, please enjoy Pittsburgh. I know you wanted to be here, but next time. Thank you so much and have a wonderful rest of the conference. Enjoy and have a safe trip back home.